It is the high noon hour, and so in the interest of getting started on time, let's get started on time. Let's take a moment of silence to remember why we're here for the families in Tennessee that are suffering as a result of our current opioid crisis. Thank you. Thanks everybody for coming. Thanks, Mayor, for having us. Like coming to Franklin, and love the mayor's hospitality and healthy food. Of course, we have chicken is healthy no matter if it's deep fried or not. So I want to start the meeting off today with not a roll call. I'd like to start to my left and just a brief introduction. We've got some new faces in the audience today, and there's some new presence online that I saw up there a little while ago. So if you don't mind, just introduce yourself and a quick half-liner about where you came from and what you do.
I'm Tim Fournette. I'm a cardiologist in Cookeville, Tennessee. I live in Monterey, and I'm on the board of volunteer behavioral health.
I'm Ken Moore, the mayor of Franklin, and a retired orthopedic surgeon, and
Executive Director of Metro Growth Coalition in Knoxville, and I was appointed by the county president.
Tom Farmer, appointed by Senator McAllen. What do you do, Tom?
He can't tell you.
In my day job, I do work with this bureau.
And somehow we haven't given Brian a microphone. Brian, I don't think that speaks to how we feel about you.
Yeah, we've got some sharing.
Hi, I'm Brian Buck. I'm the CEO of Ridgeview, the community mental health center that serves Anderson, Rome, Morgan, Scott, Campbell, Pinterest, and Union counties. And I was appointed by Lieutenant Governor McAllen as well.
Clay Jackson, I'm in Paladin here in Memphis, Tennessee. I'm not sure who appointed me. They probably did.
Lisbeth Pittman from Northeast Tennessee. I'm the Director of Families Free, and I was appointed by the Mayor's Association.
I'm Shane Sexton. I'm a former criminal court judge, had a drug court for many years. I would think I was appointed by CPS. I don't.
I think you were.
Okay.
Elizabeth Rickman, Program Manager for the Tennessee Opioid Abatement Council Office.
Hi, I'm Ella Reddick. I'm the project administrator for the Tennessee Opioid Abatement Council.
And Mary Shelton, the executive director, and Stephanie and Armando are online.
So we'll start with Armando Fontes.
Yes, yeah, this is Armando Fontes. It's good to see you all to be here. Law enforcement liaison with the Tennessee Highway Safety Office. Sorry that I could not be there in person due to just kind of a vigorous work schedule today.
Thanks, Armando. And Dr. Vanderpool?
Stephanie Vanderpool, Director of Comprehensive Pain at University of Tennessee Medical Center. Also joining virtually due to a challenging work schedule, but glad to be here. I believe I was appointed by the Secretary of State.
Thanks, Dr. Vanderpool. And my name is Stephen Lloyd. I'm an addiction medicine and internal medicine physician in Middle Tennessee. Mount Juliet is where I live. And it's my honor to chair this council. I was appointed by Governor Bill Lee. So before we get started, I want to take just a second. I don't know if you guys are like me, but sometimes I get in my week and I get overwhelmed. All I see is bad stuff. I don't feel like I'm making any progress on anything. And I wanted just to kind of reset us a little bit because it was only a year and 1 month ago that we met for the first time, July 8th, 2004, or not 2004, 2022 in the Tennessee Tower. And Attorney General Slatery gave us our charge that day. So 1 year and 1 month and kind of look at where we are today. And I'm proud of the work we've done. It's been challenging at times, but I would like to remind us all that we are an independent council. We were formed as a result of legislation by the Tennessee General Assembly and signed by our Governor Bill Lee. We have a liaison partnership with Tennessee Department of Mental Health and Substance Abuse Services. And so when I get like I got this week, I want always try to get back to, you know, one, what are we supposed to be doing? And two, who we trying to serve? And so I'm going to try to start our meeting off with that today. A lot of things A.G. Slattery told us on July 8th, but three words caught my attention. They're the three words he left us with. The first word was earmark. The money that we are responsible for, which right now stands at about $650 million and is likely going to go up, is earmarked. It can't go for anything else. It goes for opioid abatement. The second word he left us with was opportunity. He challenged us and he said that we are to set up a system of care for Tennesseans for the next 2 to 3 decades. And the last word he left us with was accountability. He said, Tennessee is a financially responsible state. We are. I think we're the number one financially situated state in the United States. He said, we want to fund things that work. And so I don't want us to lose sight of that. The things that we're looking to do over the coming years, we need to have a way to measure. We need to have a way to look and see if the money that we're spending is having its intended effect. Otherwise, we just dole it out and, you know, and say la vie. And I don't think that's what our charge is. So with that said, I'm going to do something I haven't done before. I'm going to invoke church. That may come as a surprise to some folks that I go to church. I actually do. And this past Sunday, our pastor, I go to a place in Nashville called Cross Point. We have a young pastor named Kevin Queen. And Kevin Queen said this past week, and when he said it, I about stood up and cheered. He said, it's easier to mistreat someone if we depersonalize them. And what I see in addiction a lot of times is that we depersonalize things. We talk about charts and graphs and overdose rates and near miss rates, and we don't look at people. And guys, it's about people. It's about Tennesseans for us. And so with that, I'm going to roll the next two things into each other because we conducted a series of listening sessions across the 3 grand subdivisions of Tennessee in the past month. We were in, Rutherford County on a Wednesday night. We were in Cleveland, Tennessee, Bradley County on a Thursday night. And through my scheduling genius, I was in Dyersburg, Tennessee, which is almost Missouri, on Friday night. And my friend Ella was there with me. And we simply opened the doors at 6 p.m. and invited whoever wanted to come in and share their story. We wanted to try to target people with lived experience. And so we got a few pictures. The only thing I did was I took about the first 15 minutes and I told them where the money came from, who got it, how much it is, where's it coming from, what's the process to distribute it, how much we already have out the door, and our announcement of funding. So I was able to share our announcement of funding, which was made in late July. But the best part of it were the stories in the room. And it took people a little while to warm up, but eventually they did. And there's 2 in particular I want to share with you. The first one I don't have a picture of, but it happened in Rutherford County. And a woman spoke up and she said, she made it a point that I knew that she was there because of her work. That was the reason she was there, is because of her job. And 2 sentences later, she told us how worried she was about her daughter who had just went into rehab for not the first time. And I stopped her because why was she really there? She was there because of her daughter, and she was worried about her daughter, and she was ashamed to lead with that. And it speaks to part of what we face in Tennessee today, because we allow people to die in our homes of addiction and we don't tell anybody because we're afraid, we're ashamed, we're stigmatized. And so hopefully we helped her move past that a little bit. It's okay to be there for your job, but you're really there for your daughter. And that's okay. It's okay to be somewhere for your daughter. The second one I want to share with you is this one. And these stories, these stories kind of all followed the same pattern at each of the places that we were at. So this is Juliana. Unfortunately, Juliana will always be 17. So Juliana's mother worked at a local hospital, and her daughter had struggled with substance use for some time. And she had tried to get her help on multiple occasions, and her daughter wasn't ready. But finally, on one night, her daughter got really, really dope sick and approached her mom and told her she was ready to do something. And Linda works at the local hospital. So Linda did what parents do when they don't know where else to go. She went to the emergency department of the hospital that she works in. And they found out what she was there for, and they set them over in the corner. Keep in mind, Juliana is in the throes of dope sickness. I know a few people in the room. I'm not the only one in this room that's been dope sick, but I can tell you, you'd do anything in the world not to be dope sick. So once the hospital staff finds out that she's there for that, they basically sat them over in the corner. They waited 2 hours before somebody from the admitting desk told them that they really couldn't help her, that she needed to sign out AMA and go to Vanderbilt. She died of an overdose a short time later. Hey guys, that's the real reason that we're here. We're here to set up a system of care that prevents this from happening. This is a preventable death. I can't guarantee you that had she got help that night, that she would have gotten into recovery and her life had turned out rosy. I can't guarantee that at all. Matter of fact, the odds are stacked against it. But a damn sure way for it not to happen is not to have the opportunity at all. And Juliana never had the opportunity at all. And everywhere we went, we heard stories like this. Hospital systems, and I'm not impugning the hospitals. I'm not degrading them, I'm not doing anything like that. I'm not talking about any of the current treatment providers out there. Guys, we can't get anywhere until we realize that we have holes in our system, and our system needs those holes filled so that we don't have people fall through the cracks and die unnecessarily. And so when we were in Dyersburg, we heard the same stories. And the lady who spoke up down there was wonderful. And when they started on their story, I didn't have any problem. I knew how Juliana's story finished because her mom had a picture of her on her T-shirt. So as she was telling the story, I knew how that one finished. But the lady down in Dyersburg, I didn't know how it finished. And she told the story of how she bounced from numerous places trying to get her son help at these different things. And she was given phone numbers and numbers that weren't returned and didn't have the right insurance and all of these different things that conspired against him getting help. And through the luck of a friend that they knew, they got into an abstinence-based facility in West Tennessee, and her son thrived. He's been in recovery multiple years now. He has his own family. He has a good support group around him. That story had a great outcome. And so I want to challenge my group here with me today is this: it can't be luck that she got lucky. And I want to challenge us to try our best to set up a system of care or look at a system of care where it's not luck. And I never want to depersonalize anybody. If you can't remember anything else, I remember the 17-year-old girl. I met her mom, Linda, and I met her little sister who was a freshman in high school. And all they have left is a flyer that her mom gave me. All right. With that said, I skipped, no, I didn't. I skipped down to the why. I'm sorry. So you have in front of you our minutes from our last meeting, which was down in West Tennessee in Jackson on June 23rd. And I'm hoping that you've had a chance to review them. Once you have, if we have any corrections that we need to make, I'd appreciate that happening. And when the time is appropriate, a motion to approve the minutes would be great. All right, I've got a motion to approve the minutes. Do I have a second? Second. All right, do I have any discussion? All in favor? Aye. Chair votes aye. Nays? Sorry, all opposed? No one opposed, so the motion carries. All right, fiscal update. Mary.
Yes. And before we move on, if you're not a council member, if you could please turn off your video, that will help us out greatly. Right. At each meeting, I'm going to share the current monthly opioid abatement trust fund statement. And before we move on, let me tell the council, turn to tab 13. If you could turn to tab 13, then you can pick us up with there's the agenda, and then right behind the agenda are the slides. Folks, catch up. Okay, great. And we are a couple of pages into the deck. All right, thank you. So the information that we get is current to the date that the statement was created. And this is where we are right now with our deposits and our expenditures. You can see the county, our only expenditures so far are the county distributions and then the departmental expenses, which includes salaries and travel and lunches. And I'm going to go over this in more detail in our October meeting, just to give y'all a little bit of, pulling back the curtain, what we're spending money on. Yes, Clay.
Mary spent 248,000. What period of time?
This,
That 13 months?
yes, that is, well, I was hired in September, so it's a little less than 13 months.
But we had some expenses for committee members travel.
Yes. Oh, yeah, then that must, yes, that has July in it as well.
So this is in 13 months.
You know what?
Spent.
Can I get back with you on that? That number's too low. That's not a 13-month number.
Yeah, I just appreciate knowing what our
Yeah.
run rate is.
Okay,
I realize our run rate next year will be higher. We talked about positions and all of that.
right.
I'd just like to know, I appreciate the accounting here, but it helps me to know what our, our per annum rate is. Because once we start giving out money, obviously, we'd like to give out a much larger amount.
Right. Yeah, that's a good question. I will get back with you guys on that in October and give you an idea, like and actually we have that, what we have spent each month. And I can present that to you guys in October. Does that sound good?
We meet quarterly.
Okay.
So, I think the quarterly spending would give us a better idea.
Okay. Yeah, we can certainly do that. Thanks for the question. Any other questions on the fiscal update?
All right, the announcement of funding timeline and community grants. I know that everyone is probably aware, and if you're not, our announcement of funding went out at the end of July, and so we will, Mary will update you on where we are right now.
Yeah, so this was exciting. Posted the announcement of funding on July 17th. So that included directions, instructions, a little bit of information about the legal aspects, the contact information, the timeline, and then it also included the application so that potential proposers could go ahead and look at the application and start pulling together their responses before the portal went live. We asked for intents to apply and questions to send back to us on July 31st, and I'm going to go over those in a little bit more detail here in a minute. We posted our frequently asked questions on August 15th, and there are 2 questions that I'm bringing to you guys today to discuss, review, and come up with a decision. Then I'll revise the frequently asked questions and repost those hopefully tomorrow, get that information out to the potential proposers. And we are running on schedule, if not just a little bit ahead of schedule with what I'm calling the portal. That's the subrecipient enterprise solution. I'm missing a word or 2 in there, and we're working on making that shorter for our next time around. But this is the portal. This is the web-based platform that the proposers will access to submit their application. And then we will use as well to move the application through the various stages so that it can get scored efficiently. And over the next couple of weeks, or next week, I'm going to be recording some videos, some like those YouTube instructional videos that folks can watch. That'll just be a minute or 2 that will guide them through each stage of the process in the portal. But I've had a couple of folks from the outside go in just through user acceptance testing, and they are just swimming through it just smoothly. So I'm feeling really confident about the portal. The folks from STS who have been working with us have been great and very responsive. So it has been a very positive experience. Just wanted to give y'all an update on that.
So I take it everybody got the FAQs that Mary sent out. Is anybody who didn't get it? I want to make sure that things that we send out to our entire council, everybody's getting. I thought they were well done. I loved how they were put together. Does anybody have any comments on them, one way or the other?
Are they also on the website? 'Cause I
Yes.
don't recall receiving them in my email. I may have missed them. Okay, thank you.
Yes. And Stephanie, let me take a minute to talk about the website for a moment. If you're on the website and you're not seeing the information that you're hoping to see, please get in touch with me or Ella or Elizabeth. We're happy to post any information up there that we may have overlooked. But yes, the frequently asked questions are posted on the website. Go under Our Work. And that's where the bulk of our information is located right now. It starts with the community funding, then goes to the counties, and then there are some reports at the end. Actually, we only have 1 report so far, and it's last year's annual report.
Anybody else? And I'm sorry, Dr. Vanderpool and Armando, I can't see you guys. So just
Yes.
speak up. We'll be fine. So
Okay,
does that
thank you.
include your, you bet. Does that include the announcement of funding updates as well?
Yes, and now I'm going to,
Okay.
no, I'm at frequently asked questions.
All right. Go ahead.
Okay. I'll move this out of the way. All right, we received 36 questions in total from potential proposers. So I'm excited that folks went through the announcement of funding document, sent back questions, and we were able to compile most of those answers. And several of them we were able to compile into one question as well. So, so we didn't have the overwhelming duplicated questions. There were two questions that we're asking the council to discuss and offer guidance, and I'm going to read these and then we can go into some discussion here. The first one, and we received a lot of questions about this. May we submit a proposal for capital projects, including purchasing of real estate, infrastructure, buildings, or renovations of buildings with the intent for use of opioid abatement services found in attachment A of the announcement of funding, and that's the remediation list. The second question, may a federally qualified health center, FQHC, or a free and charitable clinic provide treatment services with funds from the community grant, as these agencies are not required to be licensed by the Department of Mental Health and Substance Abuse Services or the Department of Health.
So let's, I think we need to tackle these one at a time. I guess this was one of our most frequently asked questions on our listening tour. And we did a really good job of tap dancing because we didn't have an answer. And obviously we didn't want to propose an answer without input from our council and a decision from our council, which is why we have it here today. And so I'm really hoping that the folks that have experience with applying for grants and running grants can give us some input here, because in all honesty, this is way out of my wheelhouse and I don't know. So I'll open the floor for discussion to anybody that wants, or I can start calling on you. Thank you. I was going to call on you anyway, Lisa.
Is someone speaking? It's Dr. Vanderpool.
Yes, Stephanie, can you not hear Lisa?
I cannot hear at all.
Okay. Is the microphone on, Lisa?
Great.
She's green and she's still,
You kind
can you hear
of get
me?
right up on it. Sorry.
Okay. All right. Thanks, Dr.
That's better.
Vanderpool.
Mhm.
Based on the amount of money that you receive. So I feel like that process is very vetted. And if you apply for that kind of funding, you very clearly understand that you are bound to use it for that purpose for that amount of time. And I feel like with the money that will be divvied out by this council, I would just recommend that the council follow a similar process.
And I've talked with our legal and folks within the housing. Did you get it? And that's the hope. There are a couple of little legal scenarios that I need to work with to make sure that that's something that we can do. But yes, I've looked into that. That sounds like a good plan. And thank you for noticing the word intent.
I want to ask a question on that, Lisa, if I can, because I have no experience with this whatsoever. So I want to make sure I understand what I'm hearing. So if I wanted to apply for a grant and I'm going to use it to purchase housing, and that house is $100,000. So would I appropriate a portion of that for a 5-year period? Is that how that works? I don't understand that process, because once you have the house, you have it, and then when your grant's over, you keep the house. So I'm trying to understand what you mean by what you said.
It's based on the amount of money that you get. It could be up to 20 years.
Okay.
Depending on how much money you receive. So for example, if you get $100,000 to buy a house, then that would likely be about an 8 to 10 year covenant that you would agree that you would use it for that purpose for that amount of time. So I think that getting into some of those things, and then I also would suggest that if people are applying for money for housing, that they would have a letter of support from the municipality that the house would be located in, because I feel like before money is given out for housing, for example, in Johnson City or Carter County or Elizabethton or Nashville, I think to have a letter of support from the local government, because they'll have to be done, they'll have to follow codes. And I think that could cut down on a scenario where a lot of money could be put out in play. And then once they get the money, they're not able to do the things that they have intended with that money. And I feel like having the support of the local municipalities, because that's really going to ensure your zoning, your building codes, the favor of the community, then also agreeing to use it for, say, 10 years for $100,000 for the purpose of recovery housing.
Right.
And that's general enough, but specific enough to where the money that flows through this board would be put to that use.
So I appreciate that. I understand it a little bit better.
And Dr. Lloyd, what I would add to that is, and this is kind of oversimplified, but $100,000 for 10 years of a commitment for the purchase recovery housing. If you default on that and change the purpose of that housing 5 years into it, then half of the money you would owe back to the funder, half of that amount. So whatever part you defaulted on or you didn't honor for that period of time, you would be liable to return that portion of funding.
Right. So listening at the two of you, I'm assuming that this language already exists somewhere. Okay.
If you're under the circumstance that Brian just described.
So the director of contracts at the Department of Mental Health shared with me the language. I was going to share it, but then it was suggested that I not share it at this time, because we need to make sure that this is something that we can actually, the council can come into a covenant with the potential proposers. Again, not an attorney. That's just what was the advice I received, but that's definitely something that we can research.
Tim, I know you got something. I want to ask one question or before that. So today we really can't take any action on this.
Well, I would hope that we could, because we're hoping, planning to open the portal for applications on September 1.
Mhm.
If we could allow them, if this is what the council's wanting to do, if you're wanting to receive applications for capital projects, go ahead and vote for that with the expectation that in the next meeting, I will bring options for what the contract will look like.
Okay.
So we don't have the contracts yet. We're going to use the template that the Department of Mental Health and Substance Abuse Services has. And then I will bring to the next meeting the language that Lisa is referring to.
Dr. Fernand, I'm sorry.
So
I agree, we need housing.
Oh, Stephanie also.
All right, Dr. Vanderpool, I'm sorry, go ahead.
Oh, thank you. I think I'm a little concerned about the lag time from distribution of funds to recognition of results if we fund things like building projects. I'd be more inclined in this first round of applications to fund renovations where buildings already exist than to fund a brick and mortar from the ground up building project in this first round. Not to say that once we have more information, we can't assess it, but I think if our goal is to get treatment to the people of Tennessee as responsibly and efficiently as possible, if we're taking a 6 to 8 month to 1 year build time on recovery housing, and we're trying to have them report at 24 months what the results are, they wouldn't even have the thing populated by 24 months in some cases. So what does the council think about accepting capital in this first round of applications, proposals for capital projects that include renovation of existing buildings, as opposed to just straight up plain real estate infrastructure? I'm just trying to think if there's a way to work around it. To keep in mind, our goal is to get treatment to the people of Tennessee as efficiently as possible with these projects. So we don't want a 2-year runtime on a grant that we've given out money for and we are not actually treating any patients with until 2 years from now.
Thanks, Dr. Vanderpool. Dr. Fournette.
I agree with Dr. Vanderpool. I think that we talked about our first meeting about not using all of our funds on building projects and infrastructure. That was a concern of what it would cost. And I think if we get into land and that cost of land these days and building from ground up, it'll take a long time and not get it to the Tennesseans that need it.
Thanks, Dr. Fournette. Mayor?
I'm struggling a little bit with the money for capital projects. It's a little new to me as far as the concept and how they already been working. It reminds me of people that come before my body and want to do attainable or workforce housing. And the only way to hold their nose to the grindstone is to have some type of document that deed restricts or takes that. So my comment would be that it's all the details in the contract, which I hope we'll be able to look at and understand a little better, and also maybe learn a little bit more about how that might be occurring already.
Thanks, Dr. Moore. Dr. Tommy?
I would agree. I would caution at this time going into any capital, whether it's building or renovation, in the beginning, because there's a lot of strings that come into the beginning of it, and many federal fiduciaries have prohibited those federal contract for building projects in a lot of the grants now. I would just caution that at the beginning of this. Maybe down the road, we look at this and it's different. I would just caution that.
Yep. Thanks,
Chairman.
Thanks, Tom. Yes, Dr. Jackson.
One technical concern, and Mary's already alluded to this, even if we have a solid contract, we have good legal advice, what's our clawback mechanism? And what is our statutory or regulatory authority to get an injunction, get somebody to claw back money if they renew on an agreement that we have? If we have an independent counsel, I would feel more comfortable with that, but still, do we have a mechanism for even taking back these funds? I think we need to get a legal opinion on that before we, especially before we get capital. I'm kind of with Stephanie and some others. I'm not philosophically opposed to funding capital if we have there's got to be formulas for doing this. In my mind, you think about 10 years on a house at $100,000. That's about what it takes at least one. But so by the time if somebody gives you 10 years of use of a house with $100,000, even if they sold it after that, we kind of got our use out of it for our purposes for treating Tennessee. And so there's got to be formulas about that. I'm not interested in somebody being able to flip houses on the back of the Opioid Commission to drive a Lamborghini. But I think we all agree on that, and there's ways to prevent it from contract. But just from a practical standpoint, if somebody's on fire, it's not time to build a water tower. Time to get the water that you have to them. We have excellent treatment in this state. It's just getting the patients to it.
Yeah.
Your 17-year-old that died, that was in the corner for 2 hours. The challenge is not in building a new ER. We have ERs. The challenge may not even be building another treatment facility, but we do have it. I think integration, fighting shame, real-time information about what beds are available and what insurance plans, those are things that are preventing providers. I think building another silo down the road, no matter how nice it is not the most, it may be the best answer 5 years from now. I don't think it's the most urgent answer right now. I think the most urgent answer right now is getting people to the silos next.
Thanks, Dr. Jackson. There's one more. I think Karen, did you have something? I was trying to go around. Okay, Lisa, I'm sorry.
And what I would just that maybe it would be wise to look at, to Tommy's point, another layer of accountability, of proposal. If you are asking for a capital project and you're proposing to build or renovate, and I would just offer, it really depends on who's holding the money, who their partners are as to how quick you can build something up from the ground or how quickly you can renovate it, because there's straight paths and crooked ones in both of them. But I would offer that we could add, if you are seeking a capital build project or renovation project, there's another list of requirements that you have to have. You have to have a builder on board, you have to have the city codes people on board, and you have to have the demonstrated ability to have done a project like that already. Because I think that if we look at Maslow's hierarchy of needs, and we look at what people need in our community in Tennessee, they need housing. They need a safe place to live. So I would hate to see that be prohibited, because there are people out there with the capacity and the capability, either for a reno or a new build, because they've proven they can do that.
Yeah, I agree. Mayor Moore?
I'll yield to Clay.
This has got to be too simple to be right. But what if we said to apply for capital, you have to have had one cycle with us with an awarded grant. So we've got a track record with you. We know you keep your promises. And we make capital for next time, but the only people that can apply for capital or that we would accept an application from would be people we have a prior relationship with. It's not showing favoritism. They have a track record of established services. So we fund services first. We fund people, personnel, budgets for what they're already doing. If you want capital, then we've got a 2 to 4 year track record with you, and we've seen that you deliver.
Yeah. Mayor?
I think what I see is the need, at least in our community, in my experience, is more bodies on the ground, more people on the ground. And certainly I understand the need for housing also, but I think right now we need more capacity in the system to treat these folks. My perception.
Thanks, Mayor. Lisa, I mean, sometimes common sense is just so wonderful, right? And so if we look at, Lisa talked about Maslow's hierarchy of needs, all of us in this room, regardless of what you have in your life, the most basic thing that you have and need is a safe place to lay your head at night, where you're covered from the elements and not in danger of getting eaten by wild animals. And so, and that's for everybody, but in the community that we're talking about, it's even more pressing, because it's out there, but it's out there in pockets. And Clay, exactly what you said, getting people to it is key, right? This infrastructure that gets people the help that they need when they need it. I mean, that's the deal. And there's multiple people in this room who do this for a living. One of my friends over in the right hand corner, Thomas Gooch does street works. He works at Meharry, but he goes into homeless encampments. And I don't know if anybody in here has ever been in a homeless encampment, but I went with Gooch not long ago, and it's absolutely mind blowing when you see the number of people living there and what they do during their day to survive. And these structures that they built to house themselves are actually incredible. I mean, I was blown away. But then you see them walking around with diabetic foot ulcers that is going to take an ankle, a knee, a leg without medical care. And so we're talking about, hierarchy of needs here. And that first one is housing. And that's what we're talking about right now. And so what kind of language do we need right now? Because what I'm hearing, what I think I'm hearing is that we want a pathway to do this at some point. But we also recognize the need to be able to get our dollars on the street and provide housing today. So what does that language look like for us to go forward right now?
And Mary, this may have been the contracts that you were referencing, but the department has a very well-established framework that guides, it's the Creating Housing Initiative, which is written for the very purpose that we're talking about. And to a level of detail where someone who is applying for funds would be required to have three bids on, in order for a particular amount. And it's very detailed in terms of the accountability for the dollars that are being granted. And that may be what you were talking about, Mary, in terms of the contract itself.
Yeah, and I wasn't even into those details. That's something I hadn't contemplated. So yes, Clay.
When's our next round of funding after this first one? Are we quarterly or semi-annual?
I'm planning annual.
So if we were to say no capital this time, but capital next time, we would be 12 months.
Lost your mic, Clay.
Okay, somebody muted me. So I may have muted myself. I don't.
Concerned with the amount of work that we chewed off, that we do it this well. And so I'm thinking if we add this layer of complexity to capital, I hear you, Chairman. I hear you, Lisa, and saying housing is important. I absolutely agree. I'm just wondering if we can do capital well this round, and if we'd be better served with going through one round of applications and then turning to housing to cap, or turning to capital grants in our next round of application.
There's nothing wrong with them having a mea culpa and say, we're developing this process.
Right.
And I think we need to recognize in the answer that we understand the need for housing and we're working on it, but it is a little more layered. As long as we're not shutting the door or opening it too wide right now.
Right.
We can build on it. So we can help. Yeah, we're working on it.
Well, I appreciate that,
one-
Judge. Go
Can I
ahead,
just
Dr.
comment real
Fancher.
quick?
Yes.
So one thing that we have to recognize is capital expenses are not just for housing. And so, there may be folks that are wanting to expand existing facilities to provide clinical care, to provide educational services if you're doing community education as part of your project. So if we're saying that we're wanting to avoid all capital expenses, keep in mind that things that are already potentially established that might mean just a minor modification to make them more efficient will also be negated until the next funding cycle. And remember, the next funding cycle, if we're doing it annually, means that the money likely won't go out for 24 months, not 12, or at least 18, because it's going to take us time to review the next set of applications. So my main concern is that I think we might want to revisit being very precise in what types of capital expenditure we can allow, because there may be benefit in allowing some existing organizations or grantees, potential grantees that have existing infrastructure. I'm going to pick on MDC for a second. I haven't talked to Karen at all, but I'm just saying if Metro Drug Coalition had a conference room that they wanted to reach 100 patients or 100 individuals, and right now it can only accommodate 50 and they need to upgrade their AV or something like that, that's technically a capital expense if they need to redo bathrooms or something like that to be able to make it more accommodating for their individuals. Are we going to prevent an organization that's established such as MDC from doing that type of work if we're saying we're not allowing any capital expenditures across the board?
Thanks, Dr. Vanterpool. I think always looking at unintended consequences has never been my strong suit, but I can certainly see that one. Anyone else? So what's our path forward? My concern right now is that the announcement of funding opened up at the end of July. We've got people actively working on grants as we speak. And that portal will open in a little over 2 weeks.
Yeah.
And it'll be open until October the 9th.
Right.
And so, and I agree with Judge. I mean, we're building this thing as we're driving down the interstate, right? And I don't think there's anything at all wrong with people knowing that. I mean, this is a public meeting that's out there. We all realize that we didn't exist. We barely existed this time last year. That's why I led off with what I led off with today. So what is the language that we can take that moves us in that direction, that this council can take action on today so that we're moving in that direction?
We talked about recognizing the need for housing. That should be the preamble of that whole answer.
Yeah.
that there are, and as pointed out, I didn't know all the problems with getting in housing, but there clearly are. There's a pathway there that most of us don't even know. And without us studying that and figuring out, you know, where the pitfalls are, we just probably don't need to be in that business yet. But that's the big word, yet. We're learning what we can do through capitalization, through brick and mortar. What's good, what's not, what's working, what's not. We shouldn't rule it out on the front end, and we shouldn't put a timetable on it. And say we're working this as hard as we can, trying to figure out what the best path is for the government.
Dr. Jackson.
Mr. Chairman, before we pick language, let's decide what we want to say.
Mhm.
Do we want to do any capital this round? Yes or no? Do we want to do ground up capital or refurbishing or purchase of existing structures? It's a way different thing if you're looking at the speed of the ROI, to Stephanie's point. We're talking about pulling the permit in Franklin. Lord help us. Know who the mayor. But if Susie Jones has a house on the corner and I can buy it and in 90 days have it up to code for the Department of Mental Health and Substance Abuse Services, that's a way different thing in terms of speed of ROI. So, you know, up or down, what do we think about capital this round? And then if you do want capital this round, then we need to restrict it to purchase or modification of existing structures rather than ground up. Because if you're talking about speed and talking about codes and complexity, new is always going to be slower and more difficult than purchasing something and refurbishing something. You got the conference room, you got the building, you just need your foot. That's a lot more doable.
Well, that's certainly broken down to how I can understand it. Lisa, you have I see the cockeyed brow. So let's see what comes out of that. I know.
There's a lot of ins and outs to it. I feel like the language that we came up with for the housing standards early on kind of framed out some of this. If you are an existing housing agency recognized by one of the state departments. And I feel like people who have gotten the CHIEF grant certainly would fall into that category. And it appears to me as though there's some really good percentages broken down, and the housing seems to me to fall into the recovery support category.
Agreed.
So I would offer that we might say that no more than 5% or 8% will be dedicated to a certain level of capital project that involves buildings. Because back to Karen's organization, all this is capital. Anything over $5,000 is capital. And those of us who are in this space know that. And most of those purchases have to be approved on the front end as well as having the backup that Brian talks about. So there are some mechanisms, but I feel like there are some guidelines out there that could be adopted fairly easily, but limit the amount that we're going to invest in those type of building projects, irregardless of whether they're acquired, any of those things. And then that will give us a chance to kind of slowly get into that world. So there won't be as many. We could move at a slow pace. We could get the guidelines. Because if you limit it to people who are already in that space with some department, it could be the housing department, it could be any department of the state, they're going to be vetted and kind of know the rules. And they're going to know what permits to pull or when to pull them and who to call to get them pulled. So I would just suggest that maybe make a percentage of the category that housing would fit under. And that's the cap that we're going to do this first.
Dr. Jackson, going back to your algorithm. So the answer to the first question is yes. And I think the answer to the second question is yes, but with some limitations, because I think this council's appetite for growing this as we go down the road is probably there. Once we define it and we have a little bit of a track record to go on. Am I hearing that? Is that what I'm hearing? Okay. Dr. Jackson, you have something?
Well, we have two needs. We've got a FAQ that we owe people an answer to.
Mhm.
And then we need a motion that encapsulates that for our minutes and our records.
Mhm.
So it seems that we need language for you guys to take back for the FAQ.
Yes. And that's why I know we still got the FAQ one down there. To me, that one was a little more straightforward than this one, and maybe I'm wrong, but I wanted to tackle them individually. Yeah. So I wanted to tackle them individually because we do need something to take back. We need an actual item to take back right now. I love what's come out of this. I mean, as much as I can understand it with my level of experience, I think I do. I really like what Lisa's talking about is that, you know, that starting here and then, you know, of course, what Shane comes in with is that our appetite going forward will be based on what we see, what our experiences is and what our needs are and what we see coming in here. Because the truth is none of us have seen a proposal yet, although we've seen letters of intent. So I think that's a very reasonable thing. What does that language look like?
Big yes. We are. And I think some of the ideas that have been, they are great. Start little, go big as we learn. Because, and part of this is going to be the quality of the grants, the application. You know, how well they're able to explain what they're doing. And, we can handle that. We can handle as Stephanie was saying, the minor capitalization, you know, the repair work. When we start building buildings, it's probably a little different down. And we'll need to develop the expertise to explain that. So the language should be, yes, we are. What we do will depend on what you have. We say something in that vein, not that brief, but and then we are.
Dr. Vanderpool?
What if we put, just to what Shane said, what if we put like a caveat on there that any capital expenditure should be reasonably completable within 60 days? Something that basically makes it such that it is a, it is one of those more minor capital upgrades or advancements and so on. And it allows us to vet the people who are applying, because if they say it should be completed within 60 days of receiving the funds and it's not, and there's not a reasonable reason for it, like, you know, that we can determine is considered acceptable for the reason for it to go beyond the 60 days, then maybe that allows us to gently open the door towards capital expenditure, validate and evaluate the people requesting it and their ability to accurately predict how they're going to spend and the timeline with which they're going to spend the money, and still kind of keep the budget in check for capital and kind of basically test the waters. What do you think about that, Shane? Is that kind of along the lines of what you were thinking?
Yes. Yes. Just learn as we go, learn small, go big.
Oh, I'm sorry, Mayor.
I'm warming to Lisa's idea of a certain percentage, and that way we start out small. I do understand how critical that is. I don't know what that percentage is. You said 5 or 8. Maybe we say 8. Maybe I would move that we consider allocating 8% of the funds that we might distribute it to capital projects. But with the caveat still that there's lots of questions about how you qualify all those things going down the road. And I don't think this body wants to be looking at owning a house in Hornwall, Tennessee in a couple of years. So I don't know what those protections are for us.
Thanks, Mayor. That was kind of what I was thinking. It sounded like that Lisa's idea of a percentage kind of caught all the stuff that we're talking about.
I made that in the form of motion, 8%.
So I'm sorry, Mayor, could you restate your motion?
That we consider allocating 8% of the funds that would be distributed to capital projects.
So I want to make sure I understand that. I've had the motion on the floor. I want to make sure I understand it. Are we talking about our request $100,000 8,000, I'm getting scared now. I can't do math. I try to make it 8,000 of that could be used for capital. Is that what we're talking about? Or 8% of the total amount that we allocate goes to capital projects?
8% of the
Got
total
it.
amount is what I think.
Thank you. Thanks, Mayor. Okay, I have a motion on the floor.
Armando wants to say something. Sorry.
Are you there?
Oh, well, I was waiting on a second before we had discussion.
Yeah.
If we don't have a second, our motion dies. So
I'm trying to think of Robert's rules, if you would consider a friendly amendment. I just want to make sure we're talking about this year. So
Yes.
I want to minus 8% every year because we make it better than this.
I'm referring to this year.
Yeah.
And then we would be part of the learning process, as Shane says. Maybe we increase the percentage, or maybe we see that it's a rat hole, we don't want to do that anymore, but for this year, period.
This year, a maximum of 8%. I agree with that. Definitely, I like what you said about time limitations. I think 60 days is too ambitious. It's hard to get your house painted in 60 days. It is finding construction, pulling permits and all that. So I agree with the principle of, but I think that's something we can do on the application process and internal rules for us. I don't think we have to set that in stone. I think the percentage protects us. If we're concerned about speed of ROI, I like that percentage that you guys propose, because we haven't put all our eggs in the capital basket. And when somebody says, what, some mom at the next meeting says, what'd you do to help another daughter like me? We don't have to say, well, Vanderbilt's a new lane on the hospital. We can, or any institute, we can point to 92% or more of our spent on services and coordination, et cetera, not brick and mortar.
And if I could second my own idea, I will.
you can. I was wondering if Dr. Jackson had a second in there somewhere, but I didn't. Yeah. No. So the motion on the floor as it stands, let me restate it, is that the capital expenditure will not be greater than 8% for this year. And we will look at this ongoing, if that's correct.
Correct.
All right, so that's the motion. It was seconded by half Lisa and half Dr. Jackson.
Lisa Jackson.
Is there any discussion? Is there any discussion? Armando, I think I heard you, and I didn't mean to cut you off.
No, that's fine. One thing to take into consideration when you're looking at capital allocations to different people is you may wind up having, and say you have a small entity that decides they want to get a certain amount of capital money and build a treatment center on their property, and then a year later they for some reason shut down, and then they basically come back and say, well, I'm so sorry, our treatment center just didn't take off. Now you have whatever's been built there that's been paid through these funds that's now on this private property or privately owned property. And so you got to take into consideration how, what are you going to do with those aspects, because these are funds that are being used for capital building projects or innovations.
Thanks, Armando. And I think that scenario that Brian and Clay chimed in on a little bit ago, and we're not even sure of our legal authority to go back after that. So a point taken, and something that we need to look at as the year progresses. I think I have Dr. Fournette.
Question. So if we give the 8% and someone wants $100,000, do they get the 100,000 up front? Or is it going to be in some at a time? And is there a clawback mechanism?
So we're gonna discuss the cadence for giving out the dollars here in a few minutes.
And we have discussed that before this meeting with Mary and then other folks that have experience in this, and so we'll bring that up in a second, Dr. Fournette. So we've got a motion on the floor in a second. Do we have any further discussion? Shane, I'm sorry, Judge.
Couple things
Mhm.
brought up. I remember the audit said maybe the language should be up to 8%
Mhm.
rather than it's flat 8.
Okay.
Second, touching on you, we need to have some language or at least some notice that sustainability is an issue. I think that addresses what you're talking about. Maybe a caveat, I don't know how we do that. I don't know how you do the FAQ, but somewhere in this communication analysis, it needs to say, if you get into that kind of thing, that there are issues. And we don't, my reading of the statute of our original language, I don't think we have any clawback.
Right.
There's just no mechanism. We might need to talk to Attorney General about that, but I don't see anything that gives us a remedy when one of these things goes wrong. And we need some legislation.
So first things first, up to 8% to the original motion. Dr. Moore, is that an acceptable amendment?
Absolutely. I would include that in my original.
All right, up to, and then our 2 seconders. You good with that? All right. So the language would be changed to up to 8%. And then to address Judge's second question, I think we need some guidance on that. All right.
Grant applications need to know that's a different route.
Yeah. So what does that wording look like?
Priority or special consideration on approval. And again, like, I think you raised a good point from the beginning of it. Even clawing back, we don't even know if we can accept back.
That's right.
Yes.
I've had multiple legislators, through the past few months when they call to talk about this stuff, and a lot of times it's just for somebody in their area they want us to talk to or whatever. But when this stuff comes up, they always say, hey, if there's anything that you all need going forward, please let me know. This looks like it may be one of them, because I don't see any of that either. So for purposes of this motion, what do we add to this to give us that caveat going forward? So right now we are up with the capital expenditures up to 8% for the next year. In accordance.
And ordinance or pending legislation.
Yes.
Okay.
Yeah.
Okay. All right, that sounds reasonable. Any further discussion? Are you ready for a vote? All right, all in favor? Opposed? All right, motion carries. Ayes have it. All right, and then the second part of this here, hopefully it won't be that involved. Possibly adding FQHCs and free and charitable clinics to the list of qualified agencies, as they are not required to hold a license from TDMHA. That is a wild acronym. The department or the Department of Health. I'm not sure how appropriate this is. When we started this, and we formed our small subcommittee on putting the grant together, we wanted something that was as streamlined as possible. And I am not one to heap burden upon anybody else. And Lisa's helped me with that on numerous occasions. We've got people doing good work. For God's sake, let's not saddle them with something else. So I guess that's kind of how I'm looking at this as we lead into it. So what are people's thoughts around this? We know, I think most of us at this table are familiar with FQHCs, and free and charitable clinics are, a little bit outside my realm, although I've had some opportunity to work with both of those. What do we think around this issue?
And if I can add, for the FQHCs, there is a document that they can produce that shows that they've received the HRSA funding. And for the free and charitable clinics, it's my understanding that the vast majority, if not all of them, are a member of a Tennessee association. And so that is documentation that we can request from them. So for both of these, while they may not hold a license, there's a document that shows they have that designation.
Hang on one second. I'm making myself a note, Mayor, or I'll forget. I want to make sure that we talk about that proposed legislation to give us that clawback, because I think that's something that we're going to need. All right, Mayor Moore.
I've forgotten what I was going to say. Federal qualified health provider here in Franklin, and they fill a lot of gaps for the uninsured, underinsured, and even for the insured. And I think to exclude them, since they provide so much mental health services, not only on site, but also in our schools, so that would be an important area to these cases.
Thanks, Mayor. Lisa?
I think my question would be, who would define treatment? Because the other people listed in this, Department of Mental Health and Department of Health, they have clear guidelines as to what has to be in place in order for it to be called treatment. And as Steve and I have gone around the block up in our neck of the woods in Tennessee, just because you call something treatment doesn't mean it is. And I'm all about these centers getting funding. We have some excellent ones in our area that I think can be a big piece of this puzzle of pushing out service. But what would treatment mean?
Thanks, Lisa. And we have
Can
had many animated discussions about this. Dr. Vanderpool?
Can we just also, I keep on making sure we bring it back that our abatement strategies, remember we have, in addition to treatment, we have other abatement strategies that these free clinics could potentially offer, whether it's education, whether it is naloxone distribution, whether it's something along those lines. So I think it's very important that if they may not be able to apply under a treatment facility per se, and we may, our guidelines that we've put in the application may exclude them from applying for treatment grant funds, but there may be other prevention or education funds that they may be able to apply for. I don't know what the other application subcommittee members think about that. Do we have any language that allows us to include these kind of free clinics and in some but not others, not some strategies but not others? Because I do agree with Lisa that treatment is a very specific mode of clinical care, and there are requirements and credentialing that's required. But these clinics, as Mayor said, also provide services that may be outside of treatment that would still benefit from abatement funds. So I don't want to exclude them completely.
Thanks, Stephanie. And there will be. I mean, we've talked about this. Matter of fact, Tommy and I had this discussion earlier today. There's a difference between access to care and access to quality care. There just is. And we are talking about, Lisa brings up treatment, but what Dr. Vanderpool is talking about, I think we've got harm reduction efforts out there that are necessary, to keep our patients alive. And would I consider that treatment? I guess I would, because you can't treat a dead person. So and then on the backside of that, we've been all around it here, with our first topic, which is recovery support services, which housing is a part of. So what does that language look like? Because I'm just trying to take the temperature of our council right now. It feels like we're all in support of not putting an extra burden on FQHCs and free clinics. That's what I hear. Okay. So what caveats do we put around that? I mean, because at some point, I think we're going to get a motion to say we would like them to not have to undergo this burden and they should be eligible for funding. With what caveats?
Again, Mr. Chairman, I'm probably too stupid to realize what's wrong with the statement. Looks like to me, all we're saying yes to is they can apply.
Yes.
Yes.
They got a stupid application, they got a stupid application.
Okay.
If somebody puts up something that doesn't make sense to us,
Right.
we have the ability to do that. Now, I understand the reason we brought in licensing was somebody that, if they said we're gonna provide recovery housing or but the way I'm reading this, if we say no to this, somebody who's a primary care doc in FQHC who had some chronic opioid patients, somebody said, hey, I'm addicted. And they wanted to switch them to bupe treatment. And they wanted to fund 0.5 FTE of the case manager, a social worker, at $25,000 a year in East Tennessee to track those patients and make sure that they were getting to appointments, make sure that if they had PO appointments to if they had a criminal record, if they want to provide job training in the clinic. Why would we say no to that? If it's a good application, it's a good application. So this one to me is a great question and has a very simple answer. Yes. Let them apply. And then based on what they're doing, to Judge's point, we can decide what strictures we want to place on them, or we can make it, we can have a memorandum of understanding, which said, if you get this grant, these are the things we want you to do during that to show us if you're doing good work. But I think that's tomorrow's work. I think today's work is to say yes or no. This was, unless I'm missing something here, I think this is a yes.
Thanks, Dr. Jackson. Lisa.
And I want to go back to how you define treatment. It isn't a question whether or not they could apply and provide services. That may be prevention, that may be recovery support, that may be a lot of other services, but I feel as though typically it's your funding body that creates those guidelines
Right.
as what you can put yourself forth to be. And in the case of these grants, we are that funding body. This group is the funding body who sets those parameters. If we receive funding from the state of Tennessee, they're very clear on what you can call treatment, what you can call prevention, what you can call education, what you can call recovery support.
Right.
And there's room for all of those at the table.
Right.
But funders typically define what you can.
I recognize the kid in the back seat. So Lisa, if I understand this correctly, looking forward, we could. I think we're ready to entertain a motion unless I'm misreading this. I think that Tommy Farmer is making a motion that we say yes to providing funding or accepting funding requests for FQHCs and free and charitable clinics. So I've got a motion, got a second by Mayor Moore. Any discussion? All in favor?
Aye.
Opposed?
Aye.
Chair votes aye. Motion carries. Sorry, Dr. Vanderpool. Speak quickly or forever hold your peace.
Oh, no, I was saying aye. I was voting for it. All good. Thank you.
No, I was kidding you. I'm sorry. All right, moving on, proposed application review and scoring plan. Yeah, that's right. Is that right?
We're at announcement of funding updates.
Oh, I'm behind then. All right.
Yeah,
announcement. Go ahead.
I think it's just a
Okay.
couple of slides.
Okay.
All right, so we have received 426 applications from 209 agencies. Y'all want to take a second and laugh? I mean, a good laugh, like,
Yes.
oh my gosh, this is a lot of work. We're happy. Yeah. This is very good news. We all had a couple of numbers were going around in our head and it's far exceeded. And I'm grateful that we're able to sit here and have these numbers. So this is good news. I've got them broken down by strategies. And then I didn't have enough time to put this back and forth, but do y'all remember this slide? Karen, I think you came up with this slide maybe.
She
this
did. It is you.
the proposed? I want to give credit where credit. Yeah, thank you. Thank you.
And I brought this back up, by the way, Karen. I called Mary yesterday. They said, we need this slide back. So if y'all remember, I'm sorry, Mary.
No, go
If you remember this slide, this is our guess at it. You know, we use the swag method that I talked about numerous times, scientific wild guess. And that's what this is. So we had to start somewhere. And so this is where we started with allocations into our different buckets. And so if we go back from our proposed funding buckets and look and see where we actually had proposals coming from.
So definitely the most in treatment, second in recovery support, then primary prevention, and then education, training, harm reduction, research and evaluation. 57 applications did not identify a strategy. And that was just in the intent, and this is just the intent to apply. So the idea here is to give us an idea of what the workload is going to be so that we can make sure to have the right resources available to score those. Prior to that, reviewing to make sure that they meet qualifications. And I'll go through that in just a minute.
Can you go back to Karen's?
Yep.
So the one that, as I was thinking about this when we first got started in this process and Karen came up with this list, which I love, and all the things that fit under it, my fear was that we weren't going to get anything on primary prevention. And so we set aside 15%. I remember seeing that number that day going, I think that's a pipe dream. And if you look at it, we actually got 17% of our applications were in the primary prevention. So I was very excited about that. And I think the rest of it is, it's not far off. It's a good place to start. And I know that the number looks big. I was hoping for 500, and it still may be that because these are just letters of intent to apply. But I was really excited that we got this many applications. It's a lot of work going forward. We're going to have to talk about how to tackle it. But we do have an engaged state. And my friend Clay reminded me earlier today that it's not us who will define this. These are Tennesseans that will define our direction forward. So I appreciate that. And that's what's happening. So as we look at this, Mary, where do we go from here?
Great question. So here is my proposed plan. there's a lot on this slide, so I'm going to hang out here for a minute and let y'all digest this. So first up, we'll be reading, reviewing, and summarizing each application, and that will be accomplished by or the grants analyst and then also other designated OAC staff, most likely yours truly, will be going through all of these applications. We're going to make sure that they meet, there's like 3 or 4 gates at the beginning. Are they in Tennessee? Is it their project on the remediation list? Then also if it's housing or if it's treatment, making sure that they're meeting those initial qualifications. Then if there are issues, then the grants program director, who will be Elizabeth and myself, we will review those. For some of these applications, it means sending it back to the proposer, asking them to clarify the information, asking them to provide, like if they are licensed and they didn't provide their license, different things like that, just to make sure that it is a complete application before it is sent off to be scored. Next, once we have a list of all of the applicants, we are going to send that list out to the Opioid Abatement Council members. And then what we're going to ask from you is to let us know if you either provide paid or volunteer services to that facility. And that way we will have that list and we will know how to best direct those applications to be scored. Now we're at the scoring. So, and I'm going to have a math slide after this. If you have it in front of you, you've seen the math. But this is how I'm proposing that they get scored. Each application will receive 3 reviews and scoring. The first score will come from the grants analyst. And this is what we hope to hire in the next few weeks. We're going to post this job, I believe, on August 24th. And the minimum qualifications will be someone who has worked in the substance use disorder field. So they're familiar with the substance use disorder system, treatment, prevention, various services. So dividing the 450 applications between those 2. The second score will come from the deputy director, who comes on board the day after Labor Day. He's a master's level social worker and has quite a bit of experience reviewing and scoring applications. And then we'll take, for the other 450 scores, those will be divided amongst the Opioid Abatement Council members. So each application will be read and scored by an Opioid Abatement Council member. And we'll get to that math in just a minute. Then we are going to have a time for subcommittees to meet based on strategies, looking at the applications, if there are questions around budgets, any other details that need to be worked out in a smaller subcommittee, we will have time for that. Then once we have the scores, once we have all the information from that application, I'm going to create a report that you all will be able to see all of the applicants, maybe on more than one piece of paper, maybe a few pieces of paper. Where is this applicant located? Which grand region? How many people are they serving? The budgets, if it's under $1 million, over $1 million. I also have it broken down into a few others. So there's going to be a good amount of details along with the score. And we will present those.
Pay the power bill.
Can y'all hear me? Okay. Have we lost our Teams link?
I
Okay.
can still hear you. Mhm.
Okay, thank you, Stephanie. All right,
Yeah, I can hear you.
Okay, thank you, Armando. And then those will be presented here at an Opioid Abatement Council meeting, and y'all will vote. Most likely in batches. I don't foresee 450 individual, thank you, Clay, 450 individual motions and votes, but we'll do it by batches. I will pause do y'all want me to go to the next slide? Or do you want me to pause right here?
I think that's a good place,
Okay.
a good place to pause. And I want to remind everybody from our last meeting, allocations that we approved as part of this council, not allocations, but positions. So Mary, would you mind going back through those and what we have,
Yes.
approved to this point?
Oh, I was hoping to use the overhead. Oh, thank you, Hannah.
Bio break.
Yes,
Sure.
let's take a short bio break. That's a good idea. Thank you. I'll go ahead and call back to order this meeting of the Tennessee Opioid Abatement Council. In honor of Shane Sexton being a judge and my friend Dwayne Sloan, if you're ever in a judge's chambers and you take 5, or ever in court and you take 5, that usually means 20 or 30. So I decided to go ahead and honor that judge for you there. And I'll go ahead and tell you what our delay was. We've looked back at our minutes and the positions that we were talking about going ahead and hiring at our last meeting. We never had a motion and a second to approve. And so we need to clean that up, but there's some discussion that goes around that. That's the first. Okay, it's still fine. So looking at this, we had talked about several positions last time. So Mary, would you run through those positions real quick?
Yes, so I've got it displayed on the screen. First is Deputy Director, and this will help oversee operations, lead initiatives, manage vendors, and strategic planning. Then an Executive Assistant that will provide our administrative support to the office. Then a Grants Program Director. This is a reclassing of the Program Manager position. Then 2 Grants Analyst positions. They will process and they will now be scoring the applications, reviewing the grant applications, and then just moving the applications through the Smart Simple program. 2 Accountant 3 positions. And these will provide fiscal monitoring of the community grantees. And then Attorney 3, this is not a hiring a position, but rather paying the Office of General Counsel for the services that they're already providing. So that's advising on legal issues.
All right, thanks, Mary. And so looking back at our minutes and Clay Jackson made a motion that the council approve the staffing positions. Mary had proposed with the understanding that she will explore the options of contracted versus full-time state positions to increase the expediency and efficiency and potential cost savings. And if y'all recall, there was some discussion back between the commissioner and Tommy Farmer as to the accuracy of the numbers that were presented for the cost of the contracted employees. So Mary had the option of contracted versus full-time employees for essentially the 2 grant analyst positions. So there was a motion made that was seconded and carried to hire the deputy director, executive assistant, the accountant, and the attorney. That was motion seconded and approved. But the option was the grants analyst positions, those 2 positions, and scoring these grants. So what I want to talk about here, I'm sorry, Clay.
Mr. Chairman, just for clarity, what the minutes were, I'm missing that minutes of motion.
That's all right. It's on page 12 at the very bottom. The second to last paragraph, and then the last paragraph, the motion was seconded by Wayne Wyckoff. Oh,
It's in the May meeting.
May meeting.
That would explain it. I'm in the June meeting.
Okay. All right. So it still gets us back to what we need to talk about one way or the other, because we already have a deputy director in the pipeline. And we are up against the next week deadline for the grants analyst positions. And that's the 2 that we need to talk about, because our options here are to employ them through the Department of Mental Health and Substance Abuse Services, or basically farm this out. So if you looked at what Mary presented, the process that she presented, it was with each of us participating in the grant scoring process along with 2 other people, and the number of hours that would entail of our time, versus farming it out having a score come back to this council, and this council taking action based on scores that were put together pretty much completely outside of the council and the department with farmed out grant scoring. That's where we are right now. And that's what we need to talk about. Dr. Jackson?
Well, if you guys recall from the May meeting, there was some concern. Tommy mentioned that you've got contracted employees with your department and your task force. And you felt like the numbers were closer between the cost of state employee versus contract. We talked about advantages and disadvantages. Some of the advantages being there's flexibility, we can ramp up, we can ramp down. If somebody's retired, for instance, and have a lot of expertise, they don't want a full-time state job. They want to do this 20 hours a month. You know, we could go find somebody that was on the chronic pain guideline commission, for instance, and hire that person. But the numbers that we saw indicated that contract would cost us significantly more than the employee positions. And we subsequently received information that those numbers may be closer than thought. And so with that, I have that concern. The second concern that I have, and this is just a broader philosophical discussion, we don't have to hash this all out today. But I just personally believe that the more employees that we have within state employees with any one state department, no matter what that department is, whether it's CBI, whether it's Department of Health, whether it's Department of Mental Health and Substance Abuse Services, the more folks that we have employed by a state department, the more this subcommittee begins to function as a subdivision of a particular state department. And I didn't understand that was, I thought we were an independent committee. I do understand we have a dotted line relationship through Mary to the long one. It doesn't roll off my tongue well. Department of Mental Health and Substance Abuse Services, PDM SAS or whatever. So I'm personally in favor of more of the contracted route. I think it's more flexible. I think we can hire a different type of person, part-time or full-time, rather than being limited by someone who's looking for 1.0 FTE. But our director is under a huge time.
Yeah.
Our director, we can't delay this much. So if we're not going to vote today for these other positions to be employees or to be contracts, I would say we need to have an emergency meeting, Mr. Chair, within 7 to 10 days so that she doesn't have to delay. We're under the gun. We got 429 applications coming down the pike. I think we're all in agreement that we need the staffing. It's just a question of how they're housed and whether that staffing is a state employee or whether it's a contracted position.
Thanks, Dr. Jackson. Tommy?
I would agree. I would agree, just to review that. And I would also agree with a emergency meeting.
Okay. Thanks, Tommy. Does anybody else have anything around this matter? Lisa, you got the worst poker face in the entire world. You look like you're in agreement, but I wanted to make sure that I was reading it right.
Can't hear Lisa.
That's in fact depending on the need when we receive all the applications, and then also see what kind of individuals might be out there to provide some oversight, some accountability. I think it's just the smartest route.
Thanks, Lisa. Stephanie, Dr. Vanterpool, if you don't mind, I would love to hear from you.
Yes, I'm sorry, I didn't hear all of what Lisa mentioned, but I'm curious about, we've had our conflicts of interest disclosures. We want to make sure that I'm almost interested in seeing if we could get somebody that is completely independent of the state of Tennessee, like a contracted grants analyst, only because they're analyzing the grant from the merit of the grant. They don't need to necessarily have as much relationship or have really any relationship with the grantees, and that would actually make it one of the more unbiased reviews, because we as council members would be more familiar with the state of Tennessee contributors. So I'm leaning more towards a contracted position, at least for this first round of grants, especially if we don't have that person, those persons already hired, which we can't because we didn't vote officially for the grants analyst position. That would be my recommendation, would be to do contracting to begin with. See how it goes with this cycle of grants, and then we can make another decision if we need to.
Sure. Thanks, Dr. Vanderpool. Dr. Fournette?
I agree with the contractor route. However, I'd like to know how Mary feels about this, and she has to oversee this ship.
I've never supervised contractors before, so I don't really have that experience. I think one of my main concerns is the time frame. But when I looked at hiring a contractor, the process for hiring a contractor, it seemed like the time frame was about the same. But it'll definitely be a pivot within the process. Thanks for asking. I wasn't prepared to answer, but it will definitely be a pivot.
I just want to say, Mr. Chairman, I want to strongly state that from my position, I don't have an argument with the staff. I don't want to waste money here, but I certainly don't want us to have fraudulent expenditure of money or giving away money. I mean, the staffing you need to do this job, we need to support you, and we need to vote for it. And as far as I'm concerned, because I don't have 50 hours a week to look at these. Don't. And I don't think, the judge might, he's retired.
Yeah, you knew it was coming.
He brought his grandkids to this meeting.
Yes.
Nobody, none of us, we all have full-time jobs, and being a grandparent is full-time. So we know you need staff. I just think that for a variety of reasons, the contractor route has an appeal to it. But I also want to strongly emphasize, we can't leave her hanging with these coming down the pipe and say, oh, we'll look at these figures, and in October, we're still messing around and don't have the numbers. We've got to get these people in interviews, in my mind, within a couple of weeks, closer to moving forward. I mean, if we need to have an emergency meeting next week, I'm willing to do that. And whoever needs to get the numbers together, we get the numbers together so we can compare apples to apples. But we need to give her the authority to post, hire, whatever the language is, very quickly.
So I have a procedure question. Since it's already been voted on, I just want to make sure, and I was moving forward with that information. And if we talk about it next week and we vote on it again, I just want to make sure that.
Well, I looked at that, and when I read the motion here, the motion would be that you will explore options of contracted versus full-time state positions. So for most of those up there, those are not going to be contracts. The deputy director, the 2 accounting positions, the 0.5 for us to pay back the OGC for the lawyer, and then the other position, those are approved positions. What we're talking about here are the flexibility that we had for contracted versus state employees with regards to grants analyst. That's what we're talking about. So from a procedural standpoint, I don't think we violate the intent of that motion. Clay's intent was to look and see which one of these 2 options fit our needs the best. And I think that's what we're doing right now. So with that said, there's just a couple of points for me, unfortunately, is that we have the question, all of us, most of us sitting here, almost all of us sitting here are involved in this on a daily basis. We work in this field. And nobody wants to have somebody looking at the outside saying you made a decision based on your best interest in what you do out in the private world. None of us want that. And we don't want to have to face those allegations, just like Dr. Jackson said. To me, one of the best ways to do that is to not be involved in the scoring process at all. We're simply looking at numbers that somebody from outside the process put forward to us for us to consider. And I think that says a ton. The next thing is not to get too syrupy here, but I think this is the most important work I've ever done in my life. I believe that. I don't think I'll ever do anything more important. And I want it to be completely above reproach. And so that's a little bit of where I'm coming from on that. With that said, I think we can do this pretty quickly. If I can get Tommy, if I can put Tommy on the spot and get him to agree to work with Mary in putting together these 2 options for us so we can see what it looks like from a financial standpoint. then I can call an emergency meeting, which I can at any time, as many as we need. And I don't want to do obviously too many. And I think so far we've been pretty good with that. But we'll need everybody to participate that can on Zoom so that we can handle this in an expeditious manner and be ready to score these grants come October 9th. Yes, Karen.
Can't hear.
Each basically, they're paid per proposal that they evaluate in schools. And then those scores are set in two stamps for evaluation. So they're completely people outside the system. And I personally, again, when you're talking about being unbiased, if you get anybody and we hire them in the department with expertise in this field, they're going to have a relationship just like we do. So how do you create a completely unbiased, objective process? Is to me use contracted evaluation. Because again, I don't know, Mary, what your plans are for these two grants analysts if they were hired when we don't have grants to evaluate. And maybe some clarification on that would be helpful.
So there are semi-annual reports that the applicants are going to they're going to be required to send in. So the grants analyst will be, so right now we're looking at, I guess, 450 times 2. So they will be reviewing those reports, compiling them, getting the data, making sure they're meeting their outcomes, reporting back to the Opioid Abatement Council. And then we've got to start this. So then it's rinse, repeat. Then we start the process back over. And, training someone new next year is going to cost money. So my hope is that I would be able to keep on the same 2 grants analysts, and then their expertise will follow them into the new cycle.
There, obviously there's plus and minuses for everything. And I want to tell y'all, we get together and we meet quarterly and we follow the sunshine laws and all that good stuff. But in between these meetings, a lot of stuff happens. If every state employee is working like Mary and Ellen and Elizabeth, guys, we're getting our bang for our buck on our tax dollar. I can assure you of that. And, we conducted listening sessions, and Ella and I were in Dyersburg, Tennessee at 8:30 on a Friday night. And, these folks work really, really hard. And I agree with Dr. Jackson. We want to give them every resource that we can. With that said, this is a lot of money, and there's a lot of eyeballs on it, and it needs to be above reproach. And so I think the fair thing to do right now for this council, at least in my opinion, is to look at this and call an emergency meeting when we have the data in front of us that we can make an informed decision as a council. And I guess that's what I'm asking for.
Can I speak up real quick, guys? So
I'm sorry, Dr. Vanderpool, I didn't see you.
That's okay. What I'm hearing, Mary, and I'm so glad you brought up the grant review process, because the grant review process of like once the grantees have received the funds is going to be absolutely something we need to have. I do agree that we'll need to have somebody internal that knows the process of reporting and reviewing the grant, what the person has produced or what they have documented in the annual reports or semi-annual reports. But I think we actually, especially within the next 60 days, have a more pressing thing, which is reviewing the actual applications, because I'm not convinced that we are going to fund 430 applications. We have a rubric that is going to score these applications, and we may not fund all of them. We may fund 25%, we may fund 50% of them.
True.
So I think there may be an opportunity for a multiple, a hybrid solution, if you will, where for the initial reviewing of the applications, something along the lines of what Karen suggested, where we are able to pay somebody per application that they review, while we also are getting or onboarding a grants analyst reviewer for the maintenance of the things going forward, where we're not rushed to commit to the same person. I'm not sure if that's something that anyone else on the council has comment on.
Well, if I could, as far as from an operations standpoint, if I'm looking at hiring somebody from outside, I've never done that before. So I would have to look into what the options are. And I'm looking probably just from what I know about operations and hiring, at least 3 to 5 months of pausing, figuring out who it is I can hire, how I can hire them, training them to be hired, or training them once they are hired. So I'm looking at definitely a grand pause in the process.
Can I ask a question? Clay, you said that you, from the previous meeting, we discussed this, that the numbers were looking tighter. I mean, as if it's maybe apples and apples, contract to employee. Is that what I heard, or maybe I misheard?
The previous numbers we were presented showed that contract, we would basically have to pay a substantial premium to use contracted employees versus a state employee. But we've received subsequent information that those numbers are closer. We may still need to pay a little more to have flexibility in contract, but I think those are jump closer. And I think that our chair has volunteered Tommy, he's going to get us those numbers before the emergency meeting. Right.
Well, I've heard that part.
Yeah.
But if we're close enough, I mean, how close are we? Does anybody have those numbers? But I don't know.
Right,
We'd have to keep doing it over that close.
Because, I think, Judge, in all fairness, I don't think that we know exactly how close we are, which is the whole, I agree with you. If we can, if we can shoot the duck right now, let's shoot it, but we can't. I don't think we can, because we had some discrepancies in the numbers that were presented and some experience from another member of our council who has extensive experience in this area. And when we voted on this, I remember this specifically now, it was the leeway there to look at this and have the option to do it depending on which one proved to be best for the interest of the council. And I think the council right now wants to see how tight that is. And even if it is a little more, do we get more benefit by being more transparent and more, what I was going to say, not compromised in our own evaluations of the fields that we all work in. And to me, I mean, I think that's something to really consider, because I really don't want to make decisions that the public, the Tennessee public, views as biased. And so I think that there's a price that I'd be willing to pay for that. And I think we need to look and see how close those numbers are. And I think we can do it pretty quickly. Yes, Mayor.
I'm a little bit confused.
Mhm.
We hired Mary to be our executive director and to make decisions as an executive director. And I hate to see us going down the rat hole of making decisions that she actually should be making, since she is the executive director. Been laid out there. We need certain number of personnel, and I trust in her skill and judgment that she's able to get those people, whether it's contract or state, perform the work, and hopefully without any delay in getting this money out to the people that need it.
Thanks, Mayor.
Else, if the mayor may be suggesting that we defer to her wisdom.
I trust her judgment.
I do too. We pass this around. Oh, but that is better kind of
Batting around. I think that's micromanaging, and I think we've instilled and given her a responsibility as executive director to make certain decisions, and I think this is one of them. What she thinks is best to run this group.
That as well. Mary, do you have a budget to work within? I'm just presuming that there's a budget. So maybe if there was a budget that was given, and then trust Mary's judgment to work within that budget to perform these tasks as outlined in the application scoring.
I would trust Mary to make those decisions based on her experience as an executive, that she knows how to manage the money, she knows how to manage people, and whatever's best for this group, I know that she'll make the right decision. I move that we instill those decisions to her, do what is best for this group to move forward as fast as possible.
So we have a motion on the floor that the decision in this area would be left up to our executive director, and a second. Have any discussion? Dr. Fournette?
I would just say that, to make everybody comfortable, I'm fine with Mary making a decision that she should report back her decision to us at the next meeting and tell us what the numbers were. And then if everybody's uncomfortable, then we can discuss.
The challenge there, Dr. Ford, is if we're uncomfortable and somebody's hired, we can discuss it, but somebody's already hired.
The late arrival has a question.
Oh, is that Mr. Wyckoff?
Yes, I got stuck in a court.
Oh, I'm sorry, Mr. Wyckoff. I did not realize you were here because I can't see anybody on the screen. So welcome. And ooh, I see you on the screen now, and your hand is electronically raised. So you're recognized.
Thank you. I'm sorry again. I got stuck in a court. The judge will understand that, I'm sure. It seems to me that if we can have an emergency meeting and have Mary tell us what her recommendation is, that we can kill two birds with one stone, as they say, on that, on this issue, and maybe make it move forward quickly in that way.
Thanks, Mr. Wyckoff. So is that an amendment to the mayor's motion?
Yes.
Is that an acceptable amendment, Mayor? The mayor accepts it. I'm not sure what to make of the look on his face, but whoever seconded, is that acceptable?
I said.
Okay. Oh, I'm sorry.
I did.
We lost track of who seconded it. So I think the judge seconded it. So just for clarity's sake, that we will proceed with looking at the two options. We can call an emergency meeting and get Mary's recommendation after looking at these two options, with Tommy's help in providing his experience and pricing with the outside contractor. Is that accurate?
Yes.
Okay. All right. Thank you. Is there any further discussion? Okay. Dr. Jackson.
We need to vote on this motion, but just for Mary's clarity, I mean,
I don't know what
the
I'm doing.
deputy director is already the done deal. We're talking about 2 grant samples. That's all that this motion
It is.
applies to.
Okay.
Okay.
Yep. 2 grants analysts is what we're talking about.
All the questions.
All right. The question has been called. All in favor? Opposed? Motion carries. And we will look at a date for the emergency meeting after these two have had time to collaborate. Thank you all. All right, moving on. We're only slightly about an hour behind, but we've got room to make it up because we can always push our educational sessions, which is a good thing. And I think we're at portal training for OAC. Hold on, before we move on, I don't think there's anything. I guess I can speak for the council on this. I don't think there's anything that this council doesn't trust your judgment on, Mary, just so you know.
Thank you.
And I know that I certainly don't. All right, so portal training for OAC members.
I didn't make it through reviewing and scoring.
All right,
plan.
have at it. I'm sorry. I got excited.
Okay, so I'm gonna pick it up we've gone through the process. And then this lays out what the OAC office staff will do in more detail, how much time we're hoping will take for each application, and which staff will complete the tasks. Completing reviews, we're looking at the grants analyst, the grants program manager, and the executive director. And this is all in reaction to, is that Stephanie?
Yeah, you're sharing a website, not your slides. I don't know.
Oh, thank you. Thank you.
Thanks, Dr. Vanderpool.
All right, did that take care of it?
Dr. Vanderpool, can you see that now?
Yes, that is, I can see the slides. Thank you.
All right,
Great,
thank you.
thank you. So that is the OAC office, the review of their process. And then next up so that was the reviewing. Next up is the scoring. And this is the process for the OAC members and the OAC office staff. As I mentioned, the OAC Deputy Director will review all the applications. The grants analyst, those will be divided in half. And then the OAC members will score all the applications divided by 14. We're targeting about 1 hour per application. However, the first few applications you review and score may take like a little bit extra time as you're getting acclimated to the portal and the process. So here's the math slide that I was referring to. We're looking at hoping to target about 3 months for reviewing and scoring the applications. And that will be about 10 hours a month for the OAC members to do the scoring. So again, I've used 425 as the base number of applications. There may be about 25 of those that may have a conflict of interest that we'll just send to the department staff to review. So I used 400 divided by 14, 28 applications, thereabouts, about 10 hours a month if we're using 3 months to review. And then throwing this next slide up there, as far as just wanting y'all to know that we all know there are a lot of things going on in everybody's lives as far as work and family. Definitely want to make the offer for flexibility with the reviewing and the scoring duties. If you have any prior commitments during this time frame and need to review fewer applications, or not going to single anyone out. Or if you have extra time that you can put towards and you want to review extra applications, let Steve or I know, and we can definitely be flexible with that. So going through all of that information, I have some discussion and decisions that I wanted to present to you guys for voting about how that y'all will receive these applications to vote. I'm sorry, y'all receive these applications to score, that there will be a subcommittee review. And then if there is a conflict of interest, that application will be scored by a Department of Mental Health staff. And those were the 3 decisions as I was going through the process that I felt as though I wanted to bring to you guys to make sure that the process was tracking with what y'all were thinking as far as the scoring. And I will leave that there.
Okay, thanks, Mary. And I'm looking at those 3 questions, and I'm not sure that we can answer those 3 today until we have a decision on whether or not we'll use an outside vendor or not, because some of these will be moot if we use an outside vendor, right? Unless I'm looking at things wrong. But
Mr. Chairman, I don't think so.
Okay.
As I understand the process, we were looking at 2 reviews from sort of in-house staff.
Mhm.
And then 1 review from an OAC member.
Right.
So whether those 2 grants analysts are state employees under the Department of Health and Substance Abuse Services,
Mhm.
or whether they're outside analysts,
Mhm.
we would get that score.
Right.
But still, there would be 1 score from 1 member of this committee. So I still think we need to take this vote today. And I actually like that because I want one of those scores to be one of the people from this committee, I think. I think this is a good committee. I think the state, various leaders in the state chose us to be here because of our expertise in different areas. So I don't want extra work.
Right.
I got enough work in my life, but I think we need to step up to the plate here. At least this first round, if we get in the middle of it, say, we're never doing this again.
Right.
But I think especially this first round, we need to handle this.
Yeah.
God bless Kentucky, but I think, if we're using people from there, I think we need a Tennessean at this table because we're building accountability with each other. I think one of those scores needs to be from Tim, Ken, or.
Okay. So as I understand it, there'd be 2 scores from either whoever we hire or our contract employees and 1 member from this council based on what Mary just put up here.
Yeah.
All right. All right. So let's go back to them one by one and we will
So-
entertain motions.
Yeah, this is the first one.
All right.
This is the
The first one, OAC members are assigned a batch of applications based on their experience and knowledge and review and score their assigned applications. I need a motion to approve. A move to approve. Do I have a second? Second by Dr. Fournette. Any discussion? All in favor?
Can I put a point of clarification?
Opposed? Oh,
Just point of clarification. I think it's important that we have in there, based on their experience and knowledge and factoring in their conflicts of interest. I think it's important to include that so that it's clear that we're not being conflicted when we review. It's just, I mean, it may be assumed, but I think in cases of sunshine, it's probably best to state it explicitly.
Okay, so,
Item 3 covers conflict.
so,
What?
yeah, Dr. Vanderpool, Mayor Moore's point was that item 3 covers conflict of interest.
Perfect, then never mind, we can proceed. I'll vote for the motion.
And
Carry
I'm
on.
sorry, I'll slow down a little bit. I apologize. So, all in favor, aye, all opposed, nay. The first motion carries. Next, after applications are scored, the OAC members assigned to each strategy will meet in a subcommittee to make any notes that the OAC will need for final review and approval of each application. We got to move to approve from Mayor Moore. Do you have a second? Second from Brian. Any discussion?
How are these subcommittees? Is that something we do as a group, or is that, how does that, the chair?
My thought was the subcommittee will be, that Mary and I will form the subcommittees based on, well, and bring it to the, bring it obviously to the group for approval, but based on our experience and where our strengths lie within each of those categories. Is that okay? Okay. All right, any further discussion? All in favor?
Aye.
Opposed?
Aye.
Opposed? All right, motion carries.
Then the conflict of interest.
All right, now the conflict of interest statement. If the application is submitted by agency associated with an OAC member, which may present as a conflict of interest, the application is scored by a Department of Mental Health staff member. I need a motion to approve. Move to approve by Mayor Moore, second. Second by Dr. Fournette.
Hold on, I have a question. I need us to slow down, please, because just because there's a conflict with one OAC member does not mean another OAC member cannot score the application. I don't think it means that no OAC member should score the application at all. Is that what this is saying? Because it looks like it's what it's saying. It's saying if there's an agency associated with an OAC member, which may present a conflict of interest, the application is scored by a staff member, which we have 15 people on this council. I don't think that's necessary. If we're going, then I'd like discussion on
Thanks,
that.
Dr. Vanderpool.
I accept a friendly amendment to my motion that it would, all efforts would be made to include another OAC member. If not available, then it would go to PDM HSAS staff.
So,
I didn't write this slide. I think the concern is that if it's Ken's company, that I'm on a committee with Ken and we go over there to the Chick-fil-A bar twice a meeting and we hobnob it here in the committee. And I love him so much that I would still have a conflict because I know him on the committee with him. I think that's the thought behind this, to put a firewall between non-committee members. For the record, I think as long as it's your company and Brian's voting on it, I think that's good enough. But I think the thought was that we're all buddies on the OAC committee members, and we can't objectively see something that, if I know it's Shane's grandkids got a foundation, that I'm gonna fund it because it's Shane's grandkids. I think that's the concern, that we want an ultimate firewall or whatnot, but I still think it would be good to have a clinician, somebody, if we want to kick it off the OAC. I think that's where the contract thing comes in well, because if we have a similar OAC member who's a clinician from Kentucky or Indiana, we could kick it to them and we pay them 2 hours. I think that's what it was, Ken, they're talking about, or Stephanie. But somebody can help me if that's not what they.
But we all sign a conflict of interest.
Yes.
And we're also, if we have a conflict of interest, we should state it.
We have to declare it.
Yes. I don't agree that we should kick it off the council for voting either. I think if we get to the point where no OAC member can vote on it, then yes, a staff member can vote on it or can grade it. But I find it pretty hard to believe that. I mean, we're colleagues with a lot of people on the council, but I may have, because of my work in subcommittee, have worked with you, Clay, Karen, and Shane the most, but I have not had I've had very little contact with many of our other council members outside of these meetings, and I feel very confident that I would be able to objectively score a proposal if it was on one of their organizations per se. And I would expect the same of me, because the University of Tennessee Medical Center will be submitting proposals. I will not be scoring them, but I would hope that somebody on the council would be able to objectively score that, knowing the state of Tennessee and the needs of the people of Tennessee, and not necessarily going to an outside council member and adding additional costs to the process for payment.
Yeah, thanks, Dr. Vanderpool. And sorry, there's a little bit of a delay on here every once in a while, and I don't mean to talk over you at all. And I think what Dr. Jackson was doing was making sure we understood the intent of it, and I appreciate that, because I think that is the intent of it. But with that said, what I'm hearing is that I think the council is okay with that, with that. And so Mayor Moore has accepted that as a friendly amendment to his motion, and our second there was it one of you two who seconded that? Brian did, or no, Tim did. Tim, is that acceptable to you as well? All right, so the amendment.
Question would be, in terms of legal counsel that met with us, and talked through conflict of interest, is that who put forward this process?
It came from several conversations. So, but I mean, whatever the council is comfortable with, definitely.
Could we make it clear that by default, another member of the council is designated to hear it? And then if that falls apart, then we go to staff.
And I thought that was the amendment that Mayor accepted. Is that correct?
But it's so in the language that it is by default assigned to another member, that if that fails.
Yeah, that sounds good.
Okay. All right. Any further discussion? Anybody online? Any more, Mr. Wyckoff?
No.
Okay. All right. We'll go ahead and take the vote. All in favor?
Mr. Chairman, could you read the motion we're voting on?
Yes, I can. Can we go, can we restate that?
I'm sorry, I was talking to Elizabeth.
That's
What
all
did you
right.
say?
The language that we put, because it's not the exact same language that we have up here.
Yes.
It said if the application is submitted by an agency associated with the OAC member.
You may retype it.
Yeah, we need to,
Okay.
we need to make sure we know exactly what the motion is. I'm sorry, I would have written it down. I didn't
Yeah,
realize that.
okay. I'm ready to type.
So if the application is submitted by an agency associated with an OAC member, which may present as a conflict of interest, the application will essentially be assigned to another OAC member. Is that right?
Without a
With the added step that if we can't get it, and
Yeah.
doing it goes to.
Yeah. So however you word that, with the added step that if everybody remains conflicted, then it would go the route that we had it originally.
I'm capturing it.
Does that look accurate to the council?
Mr. Chairman, is discussion closed?
No.
So my statement was, I still wanted a clinician from a similar group of people. Like, if nobody out of these 15 people could vote, because we all had COI, that we would turn to a similar member in another state, not a staff member. Because my position is the staff members or contract employees that you have here are going to offer us a very valuable, in fact, an invaluable perspective.
Mhm.
Council members have a slightly different perspective, slightly different experience and background. Most of us probably not as much experience in grants. Most of us,
Mhm.
with some notable exceptions. But some of us with more experience in treating patients or following on patients with these different problems. So if discussion is still open, I would kind of like an and or for a staff member or for contract consultant.
Oh, well, I think the discussion remains open until we get it like we want it. So,
May I ask, who is this body, or who are the secondary group?
Well, we're waiting on our executive director at the next emergency meeting to tell us if we're going to do contract employees. If we have a contract employee, we could turn to another state, somebody who's in a similar role to what we're doing, and we can contract to that person to provide just this type of service. I don't think we're ever going to that step.
Yeah, I think
I
this is gonna
don't
be
think all
very
15 of us are going to be COI on.
And I think there are people in the TDMH, SAS that are fully qualified, as you are, to review an application for their background.
Yeah.
I think you'd be able to find somebody in that staff that has, there could be another Clay Jackson, not exactly like Clay, but kind of sort of.
Well, when I read the TDM HSAS staff, I'm thinking of the 5 or 6 position that directly reports to Mary.
Oh, yeah, it was gonna be somebody else within the department.
Okay, I'm sorry.
Oh, yeah, no, I'm sorry, I didn't
I
make
mean,
that clear.
so with
That
that,
alleviates some of my concern.
So we
Okay.
take
Their
our-
perspective, y'all's perspective would be very, very valuable, but
Mm-hmm,
this is a little bit different perspective.
mm-hmm.
So if we're talking about the whole department, yeah, I'm okay with it.
So with that caveat and clarification, if we just remove that and go back to TD, to the department staff, then we're good with that. Okay. All right.
Question.
Yes, Mayor Moore.
Call the question.
Oh, I thought you said you have a question. I am so sorry. All right. So we will take the vote. All in favor?
Aye.
Opposed? All right, the motion carries. Thank you all.
All right, I'm gonna turn it over to Elizabeth real fast. She is heading up the training for the Opioid Abatement Council members on the Smart Simple platform.
This is what we've all been working towards in all our meetings, and so now it's time to have, it's about to happen.
Speak in the microphone.
Okay.
Yeah, you
Can you
have to be really close to it.
So just on the slide there, as you can see, this is just a training overview. The training sessions will be conducted via Microsoft Teams. We're all familiar with that, so we're staying with Microsoft Teams. Each council member will be individually trained, so each of you will be trained for at least 1 hour. If you need more time, just let us know. I know it says 1 hour, but if you do need us, we're available. The training sessions will be flexible, so mornings, afternoons, weekends, whatever works for your schedules, we're available for that. Also, you will receive the manual. So the training manual that we created, you'll have the guidance there that will be placed into the Smart Simple system. So you'll have, if we're not, after the training session, you'll be able to access that guide. And I'll show you once you're in there. The next one is training timeline. It's going to be from September 11th through September 29th. That's the tentative date for that, for the training sessions. Next. So the learning objectives. So at the conclusion of the community grants portal training, you all will be able to understand the your role in the system. You'll be able to navigate within the portal, and you'll be able to effectively review and score the grant applications. Again, if you have any questions, you can contact myself, Mary, or email us at the email that's there on the opioid.abatement@pn.gov.
So Elizabeth will be in touch with each one of you individually to set these up. And we wanted the training to be close to the scoring timeframe, so there wasn't going to be a gap between learning it and then putting it in motion. So we're really excited about this. It's going very well, and hopefully you will find that it'll be an easy to use platform as well.
There's no action that needs to be taken around. Does anybody have any questions or concerns? Okay, thank you all. Thanks, Elizabeth.
Thank you.
Next up is the payment cycle, and the contracting. So this is the posted time frames. The portal is going to open on September 1, close on October 9th. So it's going to be open for 5 weeks. Then next spring, we are targeting that for making the announcement for the accepted proposals. There was a date in the AOF for when the contracts are going to be effective. That was based on thinking we're going to receive much fewer applications. Now that we have a higher volume, we're putting to be determined as far as when those contracts go live. And here is the reviewing, scoring, and contracting timelines. And have I skipped some slides? Okay.
I think so.
All right, just making sure. So it lays it out a little bit more clearly here. And we'll talk about the October 2nd meeting here in a minute as well. All right, and then the payments. This question came up earlier. We're bringing to you guys a proposed payment cycle for the community grants of quarterly. They will not require invoicing, but the grantee is required to submit their semi-annual reports and participate in the fiscal monitoring from the Department of Mental Health and Substance Abuse Services to continue to receive those quarterly payments.
There were, I mean, for those of you who haven't worked in state government before, there were several options around this. And one of kind of how I looked at it when I was with the department is that when we give a grant to Lisa, then Lisa invoices us. So we're essentially like an insurance company. And that's an ongoing process that happens all the time. We don't have a huge staff, as you see, and we're trying to limit the number of staff that we do need so we can put our money in the community. And so that's where we came up with the not all up front. So here's your money for the year, go spend it, but quarterly payments. And then, of course, subject to the oversight of the state of Tennessee and the department. So that's how we came about that. And that was in discussion with me, Mary, our staff, and the commissioner. So I guess we will need a motion that the payment cycle for the community grants would be quarterly unless there's any discussion around it. We can handle that. Need be within the approval process as well.
Motion, Vanderpool.
So I was just curious whether we would be giving them the quarterly payments.
Dr. Vanderpool, did you have a comment, or did you need Karen to speak up?
I do need Karen to speak up. I was making the motion to, move for the community grant cycle to be quarterly unless there was other discussion, but it sounds like there's other discussion.
Right. Okay. So Dr. Vanderpool, Karen's question was, will the first quarterly payment happen at the first, or will it be retro after the first quarter? And I don't know that we covered that. I guess we're open to that. We felt pretty good about having a quarterly payment option, so we didn't really discuss whether or not it should be at the first or in arrears. Lisa?
But this is straight from the governor's office, and they do give all the money up front. If you could break that down into quarterly drops, because I feel like it could be a burden to seek employment or employees and incur a quarter's worth of expenses. If this should get delayed in the state system, and as we're contracting, and if people are or aren't set up in Edison.
Yeah.
And I think that will be another layer.
Yeah.
If people are already set up in Edison, it's going to be pretty quick. If they aren't, just to get into queue to accept a state payment may not happen very quickly. So I would propose that. Yeah, I think that was the only thing.
I think our intent when we did this was exactly what Lisa just described, was all up front, but we're going to break it down quarterly. That's actually what we talked about. I didn't think about paying it in arrears. So if the council's okay, I would propose that the motion would be, if this is the motion that goes forward, that we would pay that first quarterly payment up front and then quarterly after with the the ramifications or the stipulations that we stated before. Yes, Lisa.
Sorry, I
It's
did
okay.
have one more comment.
Sure.
good discussion we had around the capital projects. I think we may want to consider an additional caveat for those. Because if we do follow some of the other state guidelines that are out there, some of those expenses have to be approved on the front end. And I'm not saying we do or don't want to do that, but some of their grants, you have to submit your backup and get approval on the front end before you submit it. Others, you just produce the backup that Brian mentioned, the 3 quotes, all that. But I feel like when you get into the realm of capital and buildings, we may want to just say something as simple as there could be additional documentation required for the 8% of capital projects.
So do we need to change what our wording is here?
I don't think so.
Just leave the wording the same with the fact that that's what's going to be our approach, is what Lisa just outlined? Okay.
I think what Lisa describes is a special case, right? I mean, I think in general we think quarterly, but we'll have other.
Point, I do think that we have to distinguish if it's a reimbursable grant or if it's an upfront grant. And I think if we're talking 8% of the recovery category, if someone were awarded one of those, a quarter of that could be a ton of money before we really have our guidelines in place. So I think that we do, and I can't think of the name of the upfront money because there's only one funding source we receive from the state of Tennessee, but you get $1 upfront. So this will be kind of unique for those of us who are used to operating in this world. So I think that we can find that wording. It's how the governor's appropriations work. But I think to clarify that, and then maybe that additional documentation could be required for capital projects.
I just want to make sure I got the wording right. Okay, how's that wording? Does that look good? So the motion that we'll need would be the payment cycle for the community grants is quarterly with payment at the beginning of the quarter, and additional documentation could be required for capital projects. I have a motion by Judge Sexton, second by Karen Pershing. Any discussion? All right, we'll call for the vote. All in favor? Opposed? Opposed? All right, the motion carries.
So that's the end of our business.
That is the end of our business.
It is 2:39.
It is, and it is too late for our, and we've had a full day, to say the least. So we will ask Tommy and Lisa to put them, and I know all 3 of these people, they will have no problem doing this whenever we ask them. So I appreciate it, and I appreciate you being prepared. But you know, this was essential business we got done today, and I'm pleased with the work we've done. So thank you, everybody. We have sign in. We have multiple members of our public here, and we've reached the portion of our meeting where we have public comments. So does anyone wish to speak from the public?
Justin Coggins.
Justin, come on up.
Yeah. Oh, yeah. Shane, will you give him?
Yeah, you can come up here and have a seat. Shorts and all.
I'm Justin Coggins. I'm the president of TNR, which is the Tennessee Alliance of Recovery Residences, state affiliate for NAR, as well as the owner operator of a Design for Living recovery homes in Nashville and Dixon, Tennessee. So I just wanted to comment on I've gone through the grant carefully, and I just wanted to comment on the housing portion. I know there's a lot of facets of what you guys are doing. And my specialty is housing, so I don't want to speak on anything other than that. But when it comes to the capital and the buildings and the capital expenditures for creating recovery housing beds, I guess I just wanted to say that I really would love to see you guys take into consideration that if we're gonna create
not only more recovery housing in the state, but more quality recovery housing in the state, then there has to be money available for property. Recovery housing is not a get-rich-quick scheme for anybody that's in it. So these people that are doing quality work, that want to create more beds, it costs money. And I do like a lot of the things that was talked about around like a caveat or a covenant to say this is what this has to be used for 5, 10, 15 years, whatever it is. And making sure that we're not giving money to the bad actors that are already out there, right? Because I think that's what we do at 10R is we want to certify quality recovery housing, not just all recovery housing, right? But I think that a lot of the grading rubric takes care of that when you go into the credibility piece, the feasibility piece, and the sustainability piece, having somebody with a track record that is proven to be an asset to the community and an asset to recovery housing in general. I think those pieces of that grading rubric will take care of pushing the bad actors out because they're not going to be able to prove those things, you know? And I was telling Miss Lisa and Judge Sexton here, you know, we see stuff like this all the time, just like the overdoses, but I picked a guy up from a state licensed facility Saturday night, personally with my partner and my 2 young kids in the car because he called me needing to get out of a bad place. And I picked him up from there. He was in a 20 by 20 room with 4 bunk beds in it and 8 grown men in the basement of a house in Antioch, you know? So it's stuff like that it just drives me crazy. And I've been doing this since 2017. And I'm also in recovery from opioid addiction. So, you know, I have a strong passion for it, but I said my piece. I won't take up any more of y'all's time.
No, you're always welcome.
Thank you.
Thank you for coming in. Thank you. Okay, I'll get in here and sign in. Is anybody else here before we go online? Come on up, Dr. Red.
Thank you all for giving me the chance to speak and for the work that you're doing. This is fantastic. I'm Jacob Radford, an emergency and addiction physician here in Nashville, founder and CEO of ICLS Addiction Care, who would fall in the treatment category of the framework. We have a couple applications we're going to submit, often with sort of sub-applicants or partners, you might say. Is there going to be some mechanism to have a shareable link or downloadable PDF of the application as we work through it so that it can be done collaboratively or keep everybody in the team informed?
So yeah, I get nervous here answering questions. We're pretty much at the limitation of the vendor that we're using, which is Smart Simple. I definitely understand your question and see the need for it, but I don't think it's an option that we have right now, according to who I rely on. All right, thanks, Dr. Radford. All right.
Thanks, everybody. My name is Thomas Gooch. I work with Meharry. I also have a program that's called My Father's House in Asheville. I was thinking about a statement that I heard someone say about this application process when they was talking about accountability and approving program. I worked on a program. I worked on some grants before. I even graded grants too, so I know that's a long process. But I worked on a program before that the grant writing process was different because one thing I do know, a lot of grants come in here from a whole lot of people, and then everybody grade them, and they looking for the most. I mean, the way you word it, who back you up, who follow you up, but a whole lot of people who really do the work don't really get a chance to get these opportunities that's presented to them. And then, or they'll give the money to someone else, and then they'll trickle the change down to the person who really does the work. See, I'm really in encampments. I'm really watching people die. My wife died 4 years ago. I'm a single father of 2 kids. My other kid's mama died of an overdose. So I am a recovering addict. But a whole lot of others come to this table, never get this funding because our name is not big enough. I've been running the program for 10 years and never had a grant, never asked nobody for nothing, and it's still sustainable. But when it's time to try to qualify for this type of money, if the wording ain't right, you ain't got the right people behind you saying that you're doing this, we don't qualify for it. So at some kind of point when these applications come across these tables, I don't know if it's conflict of interest or whatever, but some kind of way you have to find out who's really doing what they say they're gonna do, as opposed to this is a big name and I believe in them, but you don't know this name, so you don't know what they're capable of doing. So I'm here to speak for those people who might not ever be at this table, because I've been looking at this table, I said, we ain't at this table. You know what I'm saying? I'm not here at this table, you know what I'm saying? But somebody got to be at this table to speak for the people like me, because I'm a part of the community that suffer from what this money is supposed to be for. So I appreciate y'all, and I appreciate and good luck to this hard tag that y'all got.
Thanks, Thomas.
May I speak to that, sir, Mr. Thomas? I'm sorry, I missed your last name. This is Dr. Vanderpool of UT Medical Center. I just wanted to highlight something that I hope will make it very encouraging for you, is that you may or may not be familiar, but we have a large cap and small cap process for evaluating grants. So we're not going to match the small community organizations that have been doing the work in the community with the major multi-million-dollar institutions that have other forms of funding. So your companies or your organizations would be compared with other like organizations. So I want you to rest assured we did consider that, because we wanted to make sure we did not exclude those individuals in the community who are doing the work. And thank you for speaking up and bringing that to the forefront again.
Thanks, Dr. Vanderpool.
Mr. Chairman.
Yes, Dr. Jackson.
Mr. Goose, this is Tennessee. You do have a seat at the table. And you'll always have a seat at the table. That's why we have public comment. Welcome your comments. You're welcome to come to every meeting, blow it up. We're ready to hear from Tennesseans. That's why we've had listening town hall meetings. That's why these are all sunshine meetings, because we want this to be an open process and we want all members of the community to be heard. And so I appreciate you coming here today and investing your time. And this committee, I can speak to this committee and say, we appreciate your voice.
Thanks, Thomas. Sadie, you can come up. And don't, the people waiting online, I haven't forgotten you, I promise. I can actually see Mary's computer screen, so I will not forget you, and I see the hands raised. So hang tight, Emily and Libby.
I'll be quicker than usual.
It's okay.
Okay, what he said, first of all, because I'm one of those,
What's your name, please?
we've been doing this since 2017. And
You mind introducing yourself? It's okay.
am I on green?
No, you're good.
Okay, my name is Addie Arback. I'm mostly known as Miss Addie. I'm a street mom for Next Step Initiative. Also the executive director of that, where it's not work. So what he said, first of all, and the second thing was, if we have capital to buy houses, we have a system now in Noon's house where instead of paying rent, first of all, if somebody is living in the woods for 8 years and they're using drugs, and that's all they can think about because of the disease, and they go to treatment for, say, 30 to 90 days, they get out and they're expected to be well. Okay, so now they're going to pay rent, work, all that stuff. It has to happen immediately when you get into that halfway house. So there's no leeway there's no time to take care of your mental state. Where are you going to go to the doctor? How do you even live indoors? I mean, all that stuff should come before them paying rent and working. Now, if they can't pay the rent, they get thrown out. But I don't see a lot of that happening to prevent them from going back out to the streets. So what we do is we bring them in and we don't charge them anything. And after we feel like they feel and we feel like they're well enough, then they go to work. They give us half of everything they make. When they leave out with that money. Our last girl left out with $6,200 and a KCDC voucher. Because we don't have a cap. When you get housing, that's when you leave. So I'm saying if we were able to buy houses with this money for this kind of thing, then we would be able not to charge them rent because the house is already paid for. Does that make sense? So it's benefiting the community and it's benefiting all of the community, because if we're not sending them back out to the streets, and we have success rates about this. We have a girl who's got her master's degree now. We have another one that went through New's house. We started it because of her. I'll try not to be too long, but the story goes, she went to treatment twice. The first time she went, she came out, she relapsed because the only place she had to go was the streets. She couldn't afford a halfway house. Second time, so she relapsed for about 4 months, came back. Miss Addie, can we try it again? So we tried it again. She graduated Buffalo Valley a second time. Anyhow, the second time she graduated, she called me about 2 weeks ago, and 2 weeks from then, and said, I'm in a house, it's my family's house, it's trap house. I don't know anybody that doesn't do drugs. I'm not sure what to do, but I don't want to use. So of course, we told her, leave the house, we went and got her. We spent the night next step to think about what are we going to do? Because even there are programs that'll pay this much to get in, and we do appreciate you guys. But that's not the answer, because then what do you do after that? It's just not enough time to heal before you're going out to work. So I guess I'm just saying, okay, so then the girl came, we spent the night. The next day, we're like, okay, this is a transitional house. We're not sure what that means. You're going to help me figure that out, but we're not going to let you get back to the streets, because we have to do. So I'm just saying that that capital money would be so helpful for programs like that. Now, if they're not going to do that, I don't know. I'm just saying that that's something we could do if we don't have to collect money from the people in order to pay the rent for the place. Just comment. Yeah, had something else, but I can't remember. It's
okay.
Okay. I guess, oh, my other thing, okay, I'm sorry, is that being paid quarterly, it is great, except, and I know that's not my spiel, that's you guys, except, okay, so I want a medical ban in order to do the street work we do. We also do Hep C and HIV on the streets, testing and counseling. If you get a quarterly payment and you want to buy something that big, it's not leaving a lot of money for the other things, instead of getting a bigger payment up front to buy, at least at first, to buy the things that cost more money. Does that make sense? I'm not sure how to put that. But yeah, so in other words, if we're just having this much money, we could do operational costs, and then this much money, where is it going to build up to where we can actually buy the new equipment that we need in order to run the business?
Steve, question, I don't think I can.
Yes, Tony.
Would you be more appropriate with withdrawal? For the drawdown?
What do you mean? I don't know what that means.
It means you would submit, it's almost like the invoice that you would submit those expenses every month.
Right.
Just a draw better.
I tell you,
That would mean they front the most.
Yes, it does.
that would mean that.
That's a good clarifying.
Right. It means basically you front the money first. You do it and it's a drawdown.
Oh, yeah, that ain't happening with next step. We don't have that kind of money. There's not a lot of funding for harm reduction. There's not a lot of funding for harm reduction. People love or hate us, and most of them don't fund for harm reduction. It's just the truth. If it's not true, somebody tell me where to go pick funding. Yeah, we've been doing this. We started in a car with no money, and we just driven. Okay, so my son died in 2015 in MRSA. And that's when I started this. Two years later, I started this on his birthday. And we kind of racked our brains about what was needed. And what we saw was nobody was going to the streets. Next Step Initiative is the first people who brought Narcan to the streets in Knoxville. We went to Clinton to pick it up because we couldn't find it anywhere. But we were like, how do you not have Narcan out here? So we found it in Clinton. And we would drive back and forth from Clinton to put it on the streets, and have put it on there ever since. Actually, we can't even get enough to keep up with. We have 2 agencies giving us Narcan now because we couldn't get enough to keep up with the demand on the streets. So we're pretty poor because it's been a struggle. Have Connect helped us out, which is through Gilead. Besides that grant, we haven't got much of anything, just little pieces of grants, United Way and National Homeless Coalition. Yeah, so yeah, for people like us that are just barely making it, it's probably a personal problem. Right now, my partner makes $100 a week. I make $2. because we don't have money to pay ourselves. We're the only two employees right now because we don't have money to pay ourselves. So no. The answer to that is for a bigger company, yes. For somebody as small as us, no. And I want to promise you, we're doing good work. Two of us have been just employed here for a year and a half. And we've done awesome work. I mean, we're taking care of so many people and we are come as you are. It doesn't matter who you are, what you do. We know that all people need love. All people need physical and mental connection. I hug every person that comes through here, and I'll give you all one too if you want it. Just, oh, not Dr. Lloyd. Everybody. But anyways, that's all. I just wanted to make those 2 points.
Thanks, Miss Addie. Thank you. Anybody else here physically present? All right, Miss Hauser.
Hi.
Hey,
I
Emily.
don't know if you, I'll put my hand down.
Yes, we can see you now.
Okay. I know that the meeting ends in about 3 minutes, and so I'm going to try and keep this short. First, thank you so much. Thanks for allowing us to have a moment to have a comment, but thank you so much for the hard work you've done. I appreciate so much everything and the opportunities that you are going to give. And basically, I know it's dollars, but it's lives, and I appreciate that. I am the executive director of the Smoky Mountain Dream Center, and I think I kind of represent a small cap, as it were. My first comment is concerning the proposal comments listed on page 12 of the announcement of funding. It basically states, quote, it is required that we have the most recent audited financial statements, income and balance sheet. That is a requirement. The issue that I would like to raise as a director of a small cap nonprofit, meaning that we earn less than $500,000 annually, is how prohibitive this requirement is, both financially and in terms of time. And a full audit is going to be over $10,000. I found that the Tennessee Code annotated 48-101-506B2 states that only charitable organizations with a gross annual revenue of over $500,000, excluding, of course, grant money, must file audited financial statements prepared by an independent CPA. So that just means that the state of Tennessee doesn't even require small cap nonprofits to have an audit on their organization because it's so prohibitively expensive and would use a significant portion of our annual operating budget in order to complete this. And at the end of the day, that doesn't even guarantee that we're going to get funding. So that's going to be a hard sell to my board to say, hey, can we take, I don't know, anywhere between 5 and 15% of our annual budget and plop it down on an audit that we may or may not get any money off of and at the end of the day. Also, I've had several CPAs advise us that procuring a full audit in the time frame required would be virtually impossible. I would like to propose.
Emily?
Yeah.
Yep. Hey, hang on a second. We've got an answer to
Go
this
ahead.
one. Hang on a second.
So Emily, at the same time you were looking at it, I was talking with our internal financial people, and you're right. So it'll either be audited financial or your most current financial statement. So
Okay.
next week, I'm going to produce a list of all of the documents that are required to be uploaded. And so it'll say audited financial or most current financial statement. So you're right.
Oh, that's such a relief. Okay. And the only other thing that I saw that really kind of puts a crimp on us small caps was on page 7, the bottom of page 6, the top of page 7. It's section 1.3.1, proposer eligibility. It states, if applying for recovery housing funding, proposer would be required to show current certification recognition status. I'm sure you guys know how that goes. But as I prepared for this meeting, I took our list from the Greene County Anti-Drug Coalition that we use in recovery court. We have a list of facilities that are residential treatment facility options that we give out. And I called every number on there what I found is we only have 28 6-month to 2-year residential programs in the state that we refer to. Families Free wasn't on there. I'm just going to say I'm adding it. But out of all of those, only 14 of them were in state that provided a bed for men and women. Some of them were just men. As I am sure you are all well aware, there's just a shocking lack of facilities available in Tennessee, and that's why there's a lot of people who are doing good work, but they don't necessarily have the certifications and the treatment. But as a, I've heard Dr. Lloyd discuss in these meetings the importance of treatment that lasts up to 2 years, and how once you have that, you'll see a significant reduction in relapse. And I didn't even find any facilities on my list that offered that level of treatment. So in my opinion, requiring proposers to already hold a certification from a standards organization is going to eliminate proposers that are looking to expand into residential treatment. I now hold a certification from the state to operate as an IOP, and I would like to expand into residential treatment. However, this eligibility requirement would prevent me from seeking funds to do that. I would like to propose an alternative so that it's no longer just luck as to who gets treatment. I think an option to this is to encourage proposers that are planning to branch into this much needed treatment area would be to drop that particular eligibility requirement and instead ask the recipients of grant funding to then show proof within a year of launching a residential program that they have applied for or in the process of receiving certification from an approved and recognized standards organization instead of the current eligibility requirement. That way, we are definitely going to jump through all the hoops. We are definitely going to do all the things. We can't go through a standards before we have the facility. We would love to grow into the facility, but we need the opportunity to apply for the grant funding and then seek the standard. Does that make sense?
No, it does make sense, Emily. It makes perfect sense. Thank you. Do you have anything else?
No, I just, I was hoping to hear what your thoughts were. I mean, obviously I want to jump in, and obviously I would love to apply for some residential funding. I would love to help out in the residential arena. I think a lot of small caps are ready to branch out into that. And, we were listening very closely when you were talking about the capital funding, because that is such an enormous need. It's just, as I'm kind of looking at the requirements, I just don't want to feel like I'm disqualified before I even begin to do the grant funding.
Thank you, Emily. It's good to see you too.
Thank you, guys.
Libby Thurman.
Hi, thank you so much for the opportunity to provide a comment. My name is Libby Thurman. I'm the CEO of the Tennessee Primary Care Association. We're the member association for FQHCs across the state. So I wanted to thank you for the motion you took earlier to really clarify that FQHCs could apply for this funding. They're very interested, and I wanted to just note, I know you had some discussion around treatment. Many of our health centers across the state are doing treatment right now. And in many cases, they are one of the few providers in their areas, and they really do strive to provide comprehensive quality services to all patients who need them. So I wanted to just encourage you, if you had any additional thoughts about how to define a treatment or to make sure that they are doing treatment as you would like them to be, since they're not licensed by the state through Department of Health or Department of Mental Health, we'd be open to brainstorming if that would be helpful, but just really wanted to thank you all for the opportunity for them to apply.
Thanks, Libby. I don't see anybody else. Is that right? Okay. Anybody else? All right. Our next council meeting will be October 2nd. And I'm biased here. I'm an East Tennessee boy, but we're going to go to Johnson City. And a good time of year to go to Johnson City is October. So we look forward to everybody coming up, and we've secured a really nice place. Lisa told me where it is, and I've been by it many times. I haven't been inside it, so I'm looking forward to going. And Northeast Tennessee is really special in October. So we look forward to everybody coming up to mine and Lisa's neck of the woods. Yes, sir.
We ordinarily meet from 12 to 3. So, was a nice place not available then, or what were we saying?
We were thinking that if you are living west of Knoxville, that you're going to have a lot of time that you would have to drive. Plus, there is the time change. So the idea is to drive down the night before, and then those that are living Knoxville east could drive up that morning. Do you have another idea or suggestion?
American had a plane, but now I can't do it. But I'm one of 15. Doesn't matter. That's fine.
Yeah.
I just, all right.
And it's in Clay, I realize, growing up, living in Johnson City, it was closer to Canada than it was where you live. So I get it. I mean, it's a long way for sure, long state. Guys, I appreciate your hard work today. A lot of stuff that was covered, and I appreciate your time and energy and passion. So thank you all.